regulate markets, reduce inequality, and deliver essential public services. As governments in the region design and implement strategies to emerge from the crises generated by the COVID-19 pandemic, the imperative of building more resilient economic, social, and environmental systems has never been more urgent. In this respect, we need to forge a new consensus whereby regional governments and their international development partners seize the opportunity presented by the pandemic to rethink the way the region's development is planned, using approaches that enhance both resilience and efficiency in pursuit of a more sustainable and equitable future. We need a new partnership framework within which the international community, specifically the richer, more developed nations and the international financial institutions, can support the efforts of the region's low and middle income countries to lessen vulnerability and build resilience. We need, I strongly suggest, a new approach to development and development financing, one whereby the G20, prompted by its OAS members and OAS permanent observers, takes the lead in showing enlightened leadership based on enlightened self-interest to safeguard the human security and human development of those struggling to extricate themselves from the vicious cycle of debt, debt servicing, more debt, and underdevelopment. We hear everywhere nowadays the catchphrase, we're all in this together. Distinguished ladies and gentlemen, this applies as much to our hemisphere and the international community as it does to our respective local realities. We're all in this together, and with the right level of global and hemispheric solidarity and cooperation, we'll get out of this together. Estamos juntos en esto, y saldremos de esto juntos. I thank you for your kind attention, and I am now pleased to place the next phase of the meeting in the capable hands of the Chair of the Permanent Council. Thank you very much.
Merci beaucoup, Ambassador
Nsanali, for that wonderful presentation as Chair and President of CD. It is a pleasure now to give the floor to Mr. Justin Ram. Fernando, can we give the floor to Dr. Ram? I gave Dr. Ram the floor, but there's an issue, a technical issue. Therefore, we will give the floor to Sir George Aline. Sir George, are you there, sir? He is the Director Emeritus of the Pan American Health Organization. Sir Aline, you have the floor, sir.
Very much. Good morning, ladies and gentlemen, and members of the Permanent Council and of CD, Secretary General. A special good morning to you and the Assistant Secretary General. It's a long time since I've had the pleasure of addressing the Permanent Council or CD. So thank you for bringing up memories of association with both of those organizations. Also, I'd like to congratulate you both on selecting this topic for discussion. For having heard Ambassador Nsanali paint such a lurid picture of what has happened as a result of COVID and what is likely to happen after COVID, there is urgent need for organizations like yours to get together and find out and try to decipher what will be the best development course for the region after COVID, because there will be an after COVID. The purpose of this session, I understand, is to find out what may be done to solidify the gains of the past and to make future gains in terms of human development in the region. The first thing I would like to make, only given the time, I'd like to make only 2 points. The first point I would make, it turns around the word resilience. This word has been used over and over again. And there's nothing more pertinent in terms of resilience than health. There's nothing more applicable to discussions about human development than health, because as we all know and all agree, health represents one of the fundamental pillars of human development. And if we look at what will happen in health after COVID, the first thing that must be done, and I am emphatic about this, the first thing that must be done is to ensure resilient health systems. Those countries which have done well during COVID represent a demonstration of the efficiency and efficacy of their health systems. So the first challenge, the major challenge in health after COVID is to ensure the resilience of our health systems. And by resilience, I refer to health systems that do well, have done well before the crisis, during the crisis, and give an earnest of doing well after the crisis. Now, what are the characteristics of the resilience in these systems? And I would posit 5 characteristics of these resilience of these systems, which we must address. Resilient systems must be aware, they must be diverse, they must be self-regulating, they must be integrated, and they must be adaptive. They must be aware, diverse, self-regulating, integrated, and adaptive. I won't deal with all of these in detail. Let me begin with the first, that systems must be aware. Our health systems must have the capacity to know what is happening. They must have the appropriate information systems to detect what is coming down the pike, and during the crisis to determine what is the best approach to dealing with it. And post-crisis must be in a position to establish what is the nature of the problems with which the public faces, and what are the mechanisms for dealing with them. Only on the basis of these information systems can we tell whether we are doing well or whether we are doing badly. So awareness in information systems is absolutely critical. I've said that health systems, which are open systems, health systems induce you to make the intervention at the point least likely to perturb the system. And information in health systems is one of the areas that is underfunded, greatly underfunded as far as health systems is concerned. And one of the things that I am sure that your organizations can do is to assist countries in having the kinds of information systems that will generate the data, the information, the knowledge that will lead to the appropriate measures to be taken. Health systems must be diverse. They must deal with a myriad of problems after COVID. They must deal with the chronic non-communicable diseases, to which I will refer later, as well as they must deal with the day-to-day problems that will occur in their populations. They must be integrated in the sense that the systems must not show an impenetrable barrier between primary care, secondary, and tertiary care. They must be integrated systems. They must deal with all of the problems of the population. And they must be adaptive. They must be adaptive in demographic terms, in physical terms, as well as in programmatic terms. One of the aspects of the health systems that we must deal with after COVID is the human resources. We know we need the financial resources. Unfortunately, in the region of the Americas, the percentage of our GDP which we spend on health is not up to the global recommendation. And in the Caribbean, we only spend about 3.4% of our GDP in terms on health, when we know it could be higher. Let me make a pause in respect to the Caribbean. The Caribbean has done reasonably well in terms of COVID. And when you look at why the Caribbean has done reasonably well in terms of COVID, it is because they have invested quite a bit in their health systems. They have invested, for example, in their epidemiological surveillance. They have invested in creating a Caribbean Public Health Agency, and they have supported they are supported by the Pan American Health Organization in determining what is the nature of the epidemic and how it is affecting the countries. And that is one of the reasons, these are some of the reasons why they have done well. And they've also done well because of political commitment to a coordinated approach to COVID in the region of the Americas. There have been several meetings of heads of the government in the Caribbean to deal with COVID. And that is one of the reasons why with this collective and cooperative approach, as the ambassador said, juntos, they have been able to address the epidemic with reasonable efficiency. I mentioned human resources, and this is a chronic problem because throughout the Americas, and especially in the Caribbean, it is the drainage of human resources to the north that represents a major problem in maintaining our health systems. So that is one area, the resilience of the health systems. The second area is one to which Ambassador Cincinnati alluded. It is an unfortunate fact that the COVID pandemic has shone a brilliant light on the problem of non-communicable diseases. It is an unfortunate fact that persons with the chronic diseases are more likely to die if they do have COVID. Persons with hypertension, heart disease, with diabetes, their mortality is much higher than those who do not have these problems in terms of COVID. If there were one reason for addressing non-communicable diseases, it would be that, but there are other reasons for it. I want to read for you a passage that Prime Minister Motley read when she addressed the World Health Assembly in May. Prime Minister Motley said, even with the pandemic, we must not drop the ball on those other global health priorities that are critical to our overall development. Notice she stressed development. I refer specifically to the chronic NCDs, the silent killers like diabetes, cardiovascular disease, and hypertension. For our populations, these challenges remain real and continue to present a silent but real and present danger. To that, many of us said, Amen. We wonder why this has been such a problem in COVID. When I look at the data for the 1918 Spanish flu, not many people showed this increased mortality because of the non-communicable diseases for a couple of reasons. One, non-communicable diseases in 1918 were not as prevalent as they are now. And as a corollary to that, in 1918, life expectancy, for example, in the Americas was about 35 years. Today it is 75 years. So with this longer period of life, there's been more time for persons to develop these non-communicable diseases. So I promise you that if there's another pandemic, you will also find that it will be enhanced mortality from non-communicable diseases. So what should the reason do? And what is the role of CD and the Permanent Council in this particular area? Of course, post-COVID, we must continue to address the treatment and prevention of non-communicable diseases. But there's one difference which I would like to emphasize. Most of chronic diseases have their origin in childhood and adolescence. Most of the chronic diseases have their origin in childhood and adolescence. So it will be imperative for us post-COVID to emphasize the prevention in children and adolescents of the precursors of these chronic diseases. And I refer to two in particular, obesity and smoking. Too many of our people are fat. About 25% of Latin American adults are overweight or obese, and the figure in the Caribbean is even higher. This is not predestined by nature. It is a problem that is correctable. And if there's one thing I would wish to dream that could happen post-COVID is a determined attempt to have the Caribbean children, adolescents become less obese and do not smoke. if there are two things I would stress that would be important post-COVID to address the future pandemic of non-communicable diseases is having our children and adolescents not smoke, and having our children and adolescents exercise and not being obese. You will hear from your colleagues in agriculture and other areas what may be done in programmatic terms to address the issue of food and nutrition in the Caribbean and the reason why our children are becoming fatter. I contend that the increasing obesity in children is also a matter for the OAS because I think it is an abrogation of the rights of the child to allow the child to become fat. So, Mr. Chairman, in summary, I would insist that post-COVID, there are many issues in health that have to be addressed, but I would insist that two that are of great importance. One, to ensure the resilience of our health systems by making absolutely sure that they are aware, diverse, self-regulating, integrative, and adaptive. And second, that we should not drop the ball on non-communicable diseases. And one of the critical inputs into that area is to ensuring that our children do not smoke and that our children are lean and fit. Thank you very much.
Su microfono, ambassador.
Les excuses là, j'ai oublié d'allumer mon microphone. Merci, Sir George Alini pour cette excellente présentation. Maintenant, nous allons accorder la parole à Monsieur Justin Ram.
I'm pleased to give the floor to Mr. Justin Ram of GSEX. He's the CEO. You're very welcome to this meeting, and we look forward to listening to. You have the floor, sir. Mr. Justin Ram.
Much for giving me the opportunity to present to you this morning. And what I will do, just getting into it immediately, is to share my screen because I have prepared a few slides to help me with my discussions this morning. Let me just do that. Okay, are you able to see those slides?
Not yet.
Hello. Okay.
If you prefer, I
How
can
is
pass
that?
for you, and you send me next, and I can put in the screen for you.
Okay. So you're not seeing the slides.
No.
Okay. All right. Let me just.
I put it for you.
Okay.
Do you see it?
Says that sharing a window. Okay, you'll put it up for me.
Yes.
Okay, you're seeing it now.
Yes.
Hello. Okay, good. Okay, so let me just begin. So this morning's presentation, I will just go through a few brief things with you. The agenda is really around our challenges and our vulnerabilities, because I think it's really important for us to understand where the Caribbean and certainly Latin America was before the pandemic, what is required for building resilience, and then an equally important topic which I think we need to look at is how do we finance resilience building. Just so the first thing here is that I really want to remind participants and ambassadors that even before COVID-19 and even before the wave of demonstrations that we've recently seen in the US and other major cities, there was a growing frustration with inequality. Inequality has been deepening in the world. More and more of the income and wealth associated with our economies are being concentrated. And so there is this, as it were, with inequality. And this particular map here shows you where there were a number of protests and demonstrations around the world in 2019. Now, I can summarize the development challenges in these 4 circles. The first one being macroeconomic, and that's really because there is low economic growth, low commodity prices, but in addition to that, there are low savings rates and high debt levels in many of the countries. Some of these also apply to the Latin American countries as well. In addition to that, productivity and competitiveness is quite low. When we look at the latest Doing Business Index figures in the Caribbean, the numbers actually say that it is easier to do business on average in places of conflict around the world than it is to do business in the Caribbean. Human development, although many countries have made significant progress, there is still high levels of poverty and unemployment, particularly among the young. And as we all know, certainly in the Caribbean, we live in a very bad neighborhood with respect to the environment. And every year we are visited by visitors who wreak significant damage on a number of countries. And this I hear I'm talking about the hurricanes. And in addition to that, there's a real implementation gap, and we don't come together enough to do things. So I say this is there's a regional approach gap as well. Now, when I look at what's happening in the Caribbean, there is a real problem as it relates to cost and the frequency distribution bell curve. What's happened is that it is skewed to the right, and it is actually negative. So this particular chart here shows that we're really operating on D1, where the frequency with which events occur, and these are not only natural disasters. For example, we know that we're quite vulnerable to any exogenous shock, but the frequency with which these are increasing and the costs associated with those shocks are also increasing. What we need to do is to move our distribution curve towards D2 or D3, so where we can get some normal distribution, and this would allow us to live in a much more manageable way. So for example, we'll be able to have insurance markets so that we can have some risk transfer associated with that. Now, some recent research, which I conducted while at the Caribbean Development Bank last year, we tried to estimate the model of the Caribbean, looking at economic, social, and environmental vulnerability. And what we found is that when you look at this all together, many Caribbean states are highly vulnerable, but you can actually break it down into the individual components to help policymakers ascertain where their resilience building should be focused on and where there should be a priority for their policy making in the short term. Now, we know that in the Caribbean, our main vulnerabilities are associated with the natural disasters, particularly with respect to hurricanes. And here we know that over the last few years, information from CDEMA and national estimates suggests that in the Caribbean, we have experienced damages of about US $27 billion. Now, what is quite striking is the statistics at the bottom of this chart, and I always try to point this out. In 2015, Storm Erica imposed about 90% of GDP losses on Dominica, and less than 2 years later, Hurricane Maria imposed about 200% of losses on the same country. When these types of events happen, it is very difficult to bounce back. But what we have to be aware of is that these events will happen. It's not if they will, but how do we actually build our resilience so that our distribution curves are more to the center and back to the left and allow us to bounce back quicker and certainly allow us to reduce the costs associated with these events. And some countries, of course, are struggling with extremely high unemployment rates, and this is exacerbating inequalities. So, major statistic that we must pay particular attention to is that 1 in 4 of our young people are unemployed. And as we know, the longer someone stays out of the labor market, the more difficult it is going to be for them to ever return to that labor market. And so this leads to unfortunate developmental outcomes, particularly around citizen security, and it can also lead to problems with respect to psychological depression. And so I think that for us, in order to build resilience, this must be a priority that we consider looking at. And I thought that it would be useful for us to look out to see what the future holds for the Caribbean. In many Caribbean countries, although on average, on total, there's expected to be an increase in the populations from 2015 to 2100 of about 3%. But from some of the major countries, there is an expectation that there will be significant declines in population. And this is all more important when we look at what's likely to happen with respect to population growth around the world. Now, the reason why I put up this chart is that we need to be cognizant as to where our new markets are likely to be in the future to allow us to help us to build trade and economic resilience as it goes along. Yes. Now, what do we need to do in order to build resilience? At the beginning of this presentation, I mentioned that there were 4 key areas where we were having significant challenges. And what I'm saying here is that we need to step back in order to jump better. We really need to be like long jumpers. Whenever you look at the Olympics and you look at a long jumper, before that athlete runs down the track, they always tend to step back before they run down the track, and that allows them to jump better. It's the same thing that we need to do in the Caribbean and Latin America. We need to step back to allow us to jump better into the future. And that means we need to manage our macroeconomic affairs in a better way. But this means that productivity and competitiveness must be improved. No longer can we expect governments to simply be the spenders of everything and to be the drivers of growth in our economies. We need to allow the private sector to do that. And by doing that, it allows governments to now begin to put aside money for savings for that rainy day. In addition to that, we have to ensure that we have good quality education for all, that our workforce is trained for the future. Now, in the discussions, we can discuss what this is, but we all know that with the COVID-19 pandemic, the workforce, the labor market has changed forever. And many of the older skills will not return to the labor market. And of course, we have environmental preparedness. And at the bottom of this, there are some cross-cutting themes of regional integration, gender equality. And we know that this is quite critical, but when we look at the majority of households that are living in poverty in the region, most of those households are female-headed households. There's also digitalization and an implementation gap, areas that we need to be paying particular attention to. Now, in addition to those 4 key areas, ambassadors, I think it's important for us to understand that there's a real important nexus that we need to be cognizant of if we are to build true resilience. That means we need to ensure that we are looking at inclusive growth, but that also means that we need to look at that nexus between providing equality of opportunity and the ability to transform that equality of opportunity that has provided to every individual into some mechanism to convert that opportunity into tangible rewards. And that is where the whole idea of a competitiveness economy comes in. It does not make sense for us to have a competitive economy without equality of opportunity, and vice versa. The both must work together. And I think that when we look at this nexus, many of the protests that we are seeing around the world, from as far back as 2016, all the way up to 2019, and then of course what we have seen recently, it is because many of our policymakers in our countries are not getting this nexus right. Some countries do much better on the equality of opportunity, and they don't do very well on competitiveness. So while people might have good education, they can't convert that into some way of turning that into a tangible reward. And the reverse is also true, whereby some countries have very competitive economies, but then there's no equality. And both of those, if they are not aligned properly, will lead to not very good outcomes. And so this is just a schematic that looks at that nexus. And if that is not working, we are going to have negative consequences, for example, crime and antisocial behavior. And of course, when this happens, people are not going to stand for it for much longer and can actually lead to an increase in populism, for example. This is just a slide that shows you how the Caribbean ranks with respect to the ease of doing business. Over 10 years between this period, the countries fell from 81 to 126. And like I said, some places in conflict around the world actually have a much better doing business environment than many Caribbean countries. Now, my final set of slides refers to how do we go about financing this resilience building. I want to say that the traditional financing architecture must change. The current financial architecture does not allow us to build resilience. We need to consider a financing mechanism that helps democratize finance. Finance currently penalizes vulnerability via high interest rates. If your country is vulnerable, no one will want to lend to you unless you pay very high interest. We need a resilience building to understand that building resilience at first is costly, and so the financing to do so must not also be costly, because what will happen is that once you've built resilience, there will be long-term rewards and avoided costs. We need a financing mechanism that provides low-cost financing now, but then can share in the benefits of that economy being more resilient in the future. And finally, I think that it is time for us to have financing mechanisms that encourages our citizens, our diaspora, to invest in the opportunities that our countries hold. Why do I think that this is important? Because I think it's important for all citizens to have a stake in their economy. And by doing so, that also creates new incentives for improvements in governance. It is quite critical. So as we think about building resilience, I want us to consider that the financing mechanisms must not focus on debt, but rather on equity investments from stakeholders within the economy and those who are interested in having a stake within those economies. So I've called this the resilience impact securities with equity, and I can explain this a bit more, but these are some of the points associated with it. This particular type of bond incentivizes continuous resilience building. It provides a resilience dividend because what the bond is at first a debt instrument, but after the resilience has been built, that debt instrument is converted into an equity stake into the asset that it has helped to build resilience to. And when I say asset, it does not only refer to physical asset, it can also refer to policy programs as well. This is just a schematic. I'm just going to skip over this so that I can get another schematic that shows how this resilience building finance can work. And I'm happy to discuss this in a little bit more detail, so I don't want to take up too much more time. But just on my last slide, I think that it is important for us to avoid culture eating resilience building for breakfast. And so how we go about implementing the resilience building is very important. And here I have an 8-step process that I have looked at or did some research globally, looked at what, for example, the Malaysians have done, or for example, what the UK did, because the UK was actually the pioneers of doing this back in the early late 1990s and early 2000s. And this, I think, is an important roadmap for us to follow if we are to bring about this change in resilience and allow us to implement some of these policy measures through this 8-step process, as it were. So, ambassadors, I think I'm going to end there and happy to discuss, answer any questions later on.
Nous remercions Dr. Ram pour cette
Much for that brilliant presentation. Now, I would like to recognize the fact that the ambassadors of Venezuela and Argentina are here. And I wanted to welcome Federico Villarreal, who is here from ICA, the Inter-American Institute for Cooperation on Agriculture. You have the floor, sir. Thank you very much. Good morning. On behalf of Dr. Manuel Otero, it is a pleasure to greet the members of the Permanent Council and CD, Ambassador Leon Charles, Permanent Representative of Haiti to the OAS and Chair of the Permanent Council, Ambassador Richard Insanali, President of CD, Secretary General Luis Almagro, and Assistant Secretary General Nestor Mendez, high authorities, guests. I want to share some slides with you to begin my presentation. I don't know where they are. If you minimize it, we were not going to see it. You need to open it up so we can see it. Thank you. Very well. Before I begin my presentation, Dr. Manuel Otero wants to apologize that he couldn't participate in this meeting. There have been intervening circumstances and he was unable to come. But as the head of technical cooperation, he asked me to make this presentation. The presentation has 5 parts. First, we're going to talk about contrasts and vulnerabilities in food security. This was a situation of the continent before the pandemic. Then we have the impact of the pandemic, then the response of Latin American and Caribbean countries to the pandemic, then the pending agenda and ICA's role. The pandemic risked a lot of the progress that has been made, and we see weaknesses. And the synthesis of the situation can be seen through 4 contrasts. The region is a net exporter of foodstuffs for $154 million. But of course, this is not homogeneous in our region. The region has large exporters like Brazil, Argentina, and Chile. And then we have countries that are net importers like Barbados and St. Kitts and Nevis in the Caribbean. And of course, we have many poor people in urban areas. This is another one of the contrasts. 45% of the rural population is under the poverty line and 26% in urban areas. This was before COVID. This is 132 million people versus 52 million in the rural areas. The third contrast that makes up this scenario has to do with nutritional problems, which other speakers have referred to. So we have the 2 sides of the coin. We have hunger, malnutrition, and then we have overweightness and obesity, which are both expressions of nutritional issues. While in some countries, the continent, we have only 5% of malnutrition, Mexico, Barbados, Uruguay. In other case, we have 15% of the population that suffers malnutrition, like Guatemala. And so 49 suffer this in Haiti, or in Venezuela, where we have 80% of the population suffering from food insecurity in 2019. Another contrast that allows us to understand the scenario that exists with regard to food security is that food producers are one of the most vulnerable sectors. Family farming makes up most of the farming in Latin America and the Caribbean, but it is very important for national markets, and it is one of the main sources of employment in rural areas, and it's important for local economies. But there are structural limits with regard to trade and others. This limits its potential, and it also makes it one of the high-risk sectors for malnutrition and food insecurity. This fourth contrast also explains this situation with regard to food insecurity before COVID. Now, to sum up this information, which is quite complex, ICA has created an index on food insecurity or food security vulnerability. It includes net import exports, income, undernutrition, budget with regard to tax income, which can help nations have income to deal with the situation, and also the current account. This with regard to foodstuffs. So it shows us Bolivia, Venezuela, and Haiti have high vulnerability indices. Haiti is number one, $800 of income per capita. The other extreme is the United States, 63,000 per capita. As we know, this does not show the heterogeneous nature of nations within their borders, but it does show us clearly what the situation is as far as food vulnerability is concerned. This was pre-COVID. Now, the impact of COVID has had many effects on food insecurity. In principle, with regard to financing of the international trade, also problems with logistics, resources, human resources. Also, this has an impact on the largest purchasers of foodstuffs. So economies have been hard hit. We've seen devastating effects on tourism, restaurants closing, and so this was important for demand as far as foodstuffs are concerned. It has also had an impact on demand for palm oil, corn, and sugar. And this has led to a fall in economic activity. Also, there has been a variation in international trade and impairment in chains, both local and international chains. This has created unemployment, less income, and also scarcity or potential scarcity, in some countries. As a result, we have had an increase in migration, poverty, and hunger. Some data with regard to the situation come from IDB. 40% of poorest households have gone hungry in the last 2 months, and almost 50% have changed their consumption, eating less healthy food. This is exacerbating the situation that already existed. ECLAC says that poverty in Latin America will go up at least 4.4%. This is 58.7 million people more than last year. This would be 220 million people in the region. At the same time, according to a report that came out yesterday, this was from ECLAC and FAO, which states that the pandemic could mean an increase of 16 million people living in extreme poverty. This is 24 million people living under the poverty line. 34 million of these people, of course, are minors. This situation, which is very serious, according to the World Bank, the most affected countries that have been hit hard by this situation include Bolivia, St. Lucia, and the Caribbean countries will be hit hardest by the recession. After that, the Andean countries. The recession in Canada and the United States will also be quite extreme, and there will be a contraction of between 3 and 6%. What is the global outlook for 2021? Shows us that recovery is possible. Latin America and the Eurozone will be hit hardest by the recession, a contraction of more than 7%. But in 2021, it looks like there'll be growth of more than 3% or almost 3%. So this means that there is light at the end of the tunnel. The projections for 2021 are looking good. So it is imperative that we make every effort to overcome the current situation. Now, with regard to trade issues, agricultural exports from most Latin American and Caribbean countries have grown or have gone down less than the total exports. This means that agriculture is a buffer in times of crisis. Export of products worldwide, 79 countries as of March of this year have gone up 8%, while exports have gone up 1.69%. This shows us what the situation of agriculture and foodstuffs are and the trade in foodstuffs in our current situation. Now, with regard to the third point, the response of countries to the situation. In principle, different actions have been taken. For example, to ensure foodstuffs to vulnerable peoples through food banks and other initiatives. This has been a fundamental response to the situation. Also, financial facilities to individuals and business so they can have more liquidity, for example, longer deadlines to be able to pay mortgages and loans. This has happened on a domestic level. And this has been one of the fundamental measures taken. Also, protocols for security and health of agricultural workers, also support for logistics to allow for marketing of agricultural products in urban areas and rural areas. This has meant that there has been support for transportation of foodstuffs, and and this is especially true in importing countries. There has been control of scarcity and speculation in local markets. In some cases, there have been price controls implemented. And finally, there has been a promotion of production in order to support the supply so that there is food available both nationally and internationally. Now, what is the pending agenda? To recognize the importance of agriculture in the strategy of recovery. We believe at ICA that this is a key point for the continent's future agenda. We need to recognize the importance of agriculture in strategic recovery post-COVID. Now, not only because the region has comparative advantages as far as water and soil is concerned, but also the sector can generate hard currency and provide income and also ensure food security. In a reactivation process, agriculture is the sector that is most or has most chains with other sectors. This can help trade, and it can again help countries get hard currency. So countries need to think perhaps of a new institutional framework for agriculture, which recognizes its fundamental role in the recovery after COVID-19. This needs to include rural areas so that all nations have food security ensured. We also need to ensure fluidity of trade and local and international chains so that there can be a provision of food security. Now, we also need to ensure the long chains of agriculture. These are fundamental to transport foodstuffs to countries that are dependent on foodstuff being imported. Also, we need to keep in mind dynamics that exist at a regional and local level. Finally, the role of ICA. In this scenario, which will be very complex and which we still don't see clearly, Latin America is facing economic, trade issues, health issues, and there may be also different waves of the disease. So we need to be flexible. We need to be monitoring the situation and be able to react quickly and in an agile way. Of course, it is indispensable that we are looking closely at the indices and that we share problems and work together. So cooperation is key. We also need to have specific and concrete initiatives to resolve the problems we are facing. In this scenario, ICA is a facilitator, or that's what we propose. We believe we are a strategic bridge so we can have innovative solutions with the private and public sector. We can be a catalyst for this. And there have been different hemispheric and regional ministerial meetings and dialogues. This thanks to our Director General, mechanisms for dialogue and coordination between ambassadors, legislators, private sector, civil society, and also with these different actors and groups, we need to make sure civil society is included. We also need to have international virtual seminars so that we can coordinate and we can know what the different responses are and need to be. Last week, for example, there was a workshop with Michael Kramer, who is a Nobel Prize winner in economics, and he talked about digital agriculture in Latin America and the Caribbean, so that he could share his knowledge with us, so we could have political cooperation and cooperation of the private sector to find solutions. What are we doing specifically? And I'm just going to mention a few initiatives with the support of the European Union. We have a COVID app. This allows us to communicate with rural farmers. It's very didactic, it's very simple, and it allows them to take measures to avoid contagion. Also, this can be used digitally at a regional level. And then there's also an app to be able to identify stocks, also an app for extension services in the Caribbean. This allows us to share knowledge and to ensure production of specific foodstuffs, which allow for food security, and this allows us to consolidate food security. We have the support of the foundation of Michael Kramer, the Nobel Prize winner. Several countries in the Caribbean are involved, and this allows us to strengthen this initiative. We have a very aggressive offer of courses online. Thank you very much, ladies and gentlemen. Thank you very much to the Director of Technical Cooperation of ICA, Mr. Villarreal. We thank you very much for your excellent presentation. I think you really hit the nail on the head by discussing the problems we are facing in the region with regard to malnutrition and food insecurity. Wonderful. Thank you, sir. Now I'd like to welcome Mr. Miguel Barreto. He is from the United Nations World Food Program. He is the Regional Director for Latin America and the Caribbean. Mr. Barreto, we are thrilled to have you with us, and you have the floor, sir. Mr. Barreto, can you please ask for the floor once again?
¿Lo escuchamos?
And we hear you. Good morning. Chair of the Permanent Council, Chair of CD, Secretary General, Assistant Secretary General, delegates and representatives of member states, ladies and gentlemen. To fight the spread of COVID-19, most countries in Latin America and Caribbean have taken preventive measures such as social isolation and closing borders. The World Bank believes that Latin America will be the most affected region in the world, that there will be a contraction of 7%. the worst in the world. And so assistance measures will be affected, and this will, of course, lead to more poverty and inequality. But also, the pandemic also exercises pressure on production, agriculture sector, consumption of foodstuffs. In other words, food security will be affected. In 2019, 3.4 million people were facing grave food insecurity in 11 countries: Bolivia, Ecuador, Nicaragua, Honduras, Guatemala, Haiti, Dominican Republic, Barbados, and others. In keeping with a remote evaluation, and after the pandemic has hit, this has gone up to 14 million people, and this includes 400,000 in the island states of the Caribbean. This means 11 million people, additional people, cannot meet their basic food needs. This is what, both in quantity and quality. And if we include those that face moderate food insecurity, this goes up to 80 million. So we are very concerned about the repercussions on migrants, especially in South America, because most of them are not covered by social programs, and to a large extent, they depend on the informal economy. 500,000 of these people face severe food insecurity, and others face moderate food insecurity in Colombia and other countries. We are very concerned about Haiti, where the number of people facing severe food insecurity has gone up from 700,000 to 1.6 million after COVID hit. Another geographical area which is vulnerable is Central America, where the number of people who were already in food insecurity has gone from 1.4 to 3 million in just a couple of months. In Haiti, and in this area in Central America, where we have had little rain, and this is caused drought. And so what we see is harvests that are supposed to be in September, and that surely in El Salvador and others, there will be a decrease in harvest. And then we have the impact in Brazil, Argentina, Chile, Mexico, and Venezuela. In Venezuela, for example, in a recent evaluation we did in 2019, we already saw that 2.4 million people faced severe food insecurity. And now we are trying to get into the country. We're negotiating that so we can see what the situation is in Venezuela. Now, with regard to food security measures, these need to be improved in this context. And also, we need to provide support to small farmers so they can increase their productivity and they can market their products. In Haiti, for example, the World Food Program continues its works. There are also support programs for for small farmers, so that we can ensure production and so that they can have access to markets and to inputs. But the most important thing now is social protection. The programs of social protection are key because they can be expanded, adapted, and used to help vulnerable people. Before 2019, we had thousands of people that received these programs, 35%. And some countries have actually expanded this, especially financial transfers. And we need to remind governments that they need to expand programs and include migrants and informal workers. I'm very happy to announce that the World Food Program has begun a program in Colombia, in Arauca, to help migrants be included in social programs, this through external funding. We already support migrants in Colombia, but we're including new people. The World Food Program is also working with many governments to improve social protection so that more needy people can receive help in the pandemic. Ecuador, El Salvador, Peru, Dominican Republic, Haiti, and small island states in the Caribbean also are working with us. We have been investing in capacity, technical assistance, design, targeting, monitoring, and evaluation for years to ensure that social programs can also react to crisis. For example, the food through schools shows the potential of social programs to be able to respond to crisis. Because of the pandemic, most schools in the region are closed. But we have been working with governments to ensure that children are receiving food nonetheless through the schools. And we're working so that these children can take food home. This will help the whole family. We've done this in Bolivia, Honduras, or in Nicaragua. Schools are still open and the program continues to work with, of course, protocols for food and sanitation protocols. We also have national food programs through schools, and also governments are doing purchases together. In Argentina, we don't have a permanent presence, but we are supporting the Ministry of Education to come up with a biosecurity protocol for when schools reopen. But the link between food security and resilience to disaster is key. Unfortunately, extreme events can happen even when we have a pandemic. Many people in our region live in high-risk areas, so we are concerned about how governments will respond to so many crises at the same time. We have COVID-19, but we have the tropical storm and hurricane season beginning. So we believe that we will have a hurricane season that will be more extreme than other years. In El Salvador, for example, 150,000 people were affected by Tropical Storm Amanda, but 350,000 face food insecurity because of this tropical storm. We need to act to save lives before these groups are hit so hard. We need to manage disaster risk. In Guatemala, we're working on microinsurance for the agricultural sector. This is for farmers that live in the drought area, so that these farmers are more resilient. And we need to have early warning systems. This can save lives and lead us to have more and better humanitarian assistance. Because of the limited time, I can't tell you about all the initiatives we have taken, but in 2019, we've helped more than 6 million people. And this year, I'm sure this will be doubled, without, of course, mentioning the 200 million people that we help indirectly through capacity building, technical assistance, etc., in the countries where we have a presence.
On the headlines. This subregion has always been vulnerable to natural events, but with climate change, we are seeing a greater severity of storms. These events erase development gains and set back countries by a generation or more. Dominica, for instance, lost over 200% of that GDP as a result of the Hurricane Maria in 2017. Underlying issues in the Caribbean and the economic dependencies on service industries pose significant challenges to the subregion, and shocks such as COVID-19 has profound implications in terms of food security, people's livelihoods, markets, and imports. An online survey launched by WSP, CARICOM, SEDEMA, and FAO in early April concluded that COVID-19 has caused widespread disruption to markets. Price increases were reported by nearly 60% of the survey respondents. Nearly half of respondents reported job loss or reduced income or revenues. As said, WSP estimates there are some 400,000 people who are severely food insecure across the Caribbean. The Eastern Caribbean has a number of countries of concerns, particularly now Dominica and St. Lucia, when we are starting now support to their own social protection systems. This map truly reflects the vulnerability of the Caribbean from a food security perspective. The Caribbean imports over 80% of its foods and has 5 billion import bill. While global production levels are good, issues around supply chains and labor markets could be of concern for import-reliant countries. It is clear that more must be done to diversify economies, increase agricultural productivity, and modernize systems as part of building back better in a post-COVID-19 environment. WSP is currently assisting the government of Dominica and St. Lucia as set to scale up cash assistance through social protection in order for people to meet food security and other basic needs. We are also increasing our technical assistance to governments in the region to use their social protection systems and programs to meet additional needs. We are working closely through our office in Barbados with SEDEMA for a coordinated response. It is important that governments prepare to respond to multiple crises, and we at WSP will continue to assist them in doing too from our regional office in Panama and also through our office in Barbados. Como la agencia humanitaria más grande del mundo y siendo el brazo logístico de las Naciones Unidas, con principales como Canadá y los Estados Unidos, que son miembros de la OEA.
All major partners for the distribution of food. Partnership with the OAS is another critical link, and we can buttress it through your areas of food security and the response to emergencies. And in that regard, we know, Secretary General, and that you will welcome our offer of assistance, as we have done already in the area of environmental security and migration. We cannot leave anyone behind. That's the bottom line. And we must reach out to those who are most vulnerable. That means subsistence agriculture and informal workers, that is, workers in the informal economy. We will remain steadfastly alongside governments and organizations that are interested in buttressing their capacity to face these crises and to avoid that we end up in a pandemic of hunger, as our executive director said it at the World Food Assembly. Those who are suffering now will double by the end of 20 and will reach 230 million people before long. We're already seeing the impact of that onslaught in our own region. I thank you very much for your kind invitation. Mr. Miguel Barreto, many, many thanks indeed for your presentation, sir. I now appreciate again everything you've shared with us about the fight for food security. And without further ado, let me extend a very warm welcome to Ms. Elizabeth Riley, the Acting Executive Director of the Caribbean Disaster Management Agency. We are honored to have you with us and eager to listen to you. You have the floor, madam.
Good morning, and thank you very much, Excellencies, for this opportunity to participate in this morning's dialogue. I specifically want to thank Ambassador Insa Namali, who extended the invitation to SEDEMA to participate. So today I wanted to speak to you on the whole topic of building resilience in the wake of the COVID-19 pandemic from a CEDIMA perspective. Next slide, please.
You are with the presentation.
Okay. Okay, thank you. And the coverage of this morning's presentation, I will just say a little bit about CEDIMA. I suspect many of you are well familiar with us. To speak also to the COVID-19 context and vulnerabilities to get a better understanding of why this dialogue is so important, to treat with the strategic approaches that have been undertaken within the CARICOM region on the topic of resilience, to identify some of the emerging lessons that we have seen so far going through the COVID-19 event, and finally to say a little bit on some observations for moving forward. So the CEDIMA, as you know, is an arm of the Caribbean community. We have a responsibility on the response side in the aftermath of events for coordinating disaster relief. But very importantly for today's dialogue is that we have a remit also under our comprehensive disaster management strategy, which I'll speak about in a moment, to promote the whole issue of resilience. And this is resilience within the context of non-emergency times, but also looking at how we can utilize the opportunity of emergencies to push the resilience message and agenda as well. The broad geographical remit means that we have quite a bit of diversity in our states in terms of the types of hazards faced and capacities. So with respect to the COVID-19 context and vulnerabilities, I think we have to recognize that within the 18 CEDIMA states, that at the start of the pandemic, there was a very varied level of capacity and planning for a pandemic. Within our populations also, what we saw is that there was a very diverse level of risk perception, particularly as it relates to individual populations. And this translated in a very interesting way in terms of the extent to which measures that were put in place, the speed at which they were taken up and applied by the population. Sir George Aline, in his presentation, raised the whole issue of the focus on the health sector. And this particular event is very specific in its nature because the national emergency management systems are fueled by the information, the intelligence, surveillance, which comes out of the health sector in order to be able to do overarching coordination. And as such, to have effective coordination for COVID-19, it relies very much on robust national health capacities and health systems. COVID-19, as we know, demands all of government and society response, including private sector. And the reality is that we are still learning as we go through this process. And that uncertainty brings with it its own types of risks. And finally, we are operating in a very complex multi-hazard environment within the CARICOM states, where at present, we're going through a drought, which has been in effect since 2019. We have an above normal hurricane season anticipated for 2020. And of course, we're dealing with the COVID-19 event. This slide I have borrowed from one of my colleagues at the University of the West Indies, George Aline Chronic Disease Research Center, Professor Ian Hambleton. And what it shows is the curves of the COVID-19 pandemic within our 20 CARICOM member states and associate member states from the time of the first case through to June 15th. And you will note that overall, the Caribbean states have been handling the pandemic quite well. The area of specific concern for us within the region is of course related to Haiti. And in fact, within the last week, according to the University of the West Indies team, we have had 1,269 new cases, and just over 90% of those have been seen in Haiti. So this is a hotspot that we're watching very carefully. Of course, at this time, countries are also having a discussion about the reopening of borders, and so we are looking at the surveillance data very carefully to see what implication that will have in terms of the number of cases. So I spoke earlier about our CDM strategy, and we in the region have adopted the comprehensive disaster management approach since 2001. And so we have always focused our efforts on the whole issue of a safer, more resilient, and sustainable Caribbean states, delivering these through various result areas. But I want to give specific emphasis to the resilience framework, which was adopted by our heads of government in the aftermath of Hurricanes Irma and Maria, which, as you heard from Dr. Ram, were very devastating for the region. And the pillars of resilience that have been identified are quite instructive for this dialogue. They speak to, first of all, if we come from the left in the set of this main diagram in the center of your screen, it speaks of social protection for the marginal and most vulnerable. And I think this is particularly applicable in the aftermath of the COVID-19 event, where we have seen severe livelihood disruption within our CARICOM states for all those reasons which were outlined by Dr. Ram earlier. And it makes it a very critical action for all of us to look at how we protect our vulnerable populations as we continue through the pandemic. The enhancement of economic opportunities is self-explanatory, and I think Dr. Ram treated this issue quite comprehensively. We also recognize the importance of safeguarding infrastructure, and we've seen the vulnerability of our infrastructure in the aftermath of various hydrometeorological events, environmental protection, because of that intimate relationship between disaster risk and environment, and of course, the critical issue of operational readiness and recovery, because at the end of the day, as much as we mitigate, as much as we build resilience, we are always going to have a requirement to respond to events that impact us. And equally important is the discussion around recovery and strengthening the capacity of our states for recovery planning and implementation of those plans. So what then have been some of the lessons that we see emerging? I know we titled the dialogue about resilience building in the wake of COVID-19, but I think it's important that we keep an eye on resilience as we go through the pandemic, and rather to talk about resilience building in the midst of COVID-19. And what are some of those things that we have been seeing, some of those key pointers? One is a requirement for a cultural shift, for us to do things differently. And a part of that is the emphasis on sector level resilience. And Sir George Aline spoke about this for the health sector, and I want to thank him for emphasizing this point. And in fact, the message has to resonate across all sectors, because we have seen the extent to which all sectors have been impacted by this pandemic, and certainly we also see it in the aftermath of hydromet hazards. We also want to give specific emphasis to governance arrangements so that we are ensuring that key persons, including the vulnerable, have a voice. We need to plan differently. COVID-19 has said to us that we have to revisit our operational worst case scenarios. And in the case of the SEDIMA system, for our regional coordination arrangement, which is called the Regional Response Mechanism. We have also seen the critical issue related to logistics and supply chains. And our representative on the panel from the World Food Program spoke to this. And this has been a critical issue for the Caribbean region. And in fact, I will speak a little bit to this in the next and final slide in terms of how we have been partnering with institutions of the Americas to move this area forward. Also very important has been the feature of regional solidarity and partnerships. And this was alluded to by one of the earlier panelists. And I think this has been really one of the critical opportunities and positives that has emerged as a lesson from the CARICOM states' experience in going through COVID-19, where the political level took a very deliberate decision to move together as a bloc on a range of issues. And I think this has augured very well for the region. And finally, another lesson has been the fact that this pandemic has really accelerated the discussion around the changing humanitarian landscape, where because of restrictions, we have seen that countries and regions have had to look a lot more inwardly in terms of how we ride out the pandemic, how we survive the pandemic and build resilience as we go through the pandemic. So we're seeing increasing importance of regional institutions, and certainly this has been at the forefront within the CARICOM region, not just related to the role of SEDIMA, but also entities like CARFA, CARICOM Impacts, which deals with security issues, etc. And of course, I think this whole issue of the opportunity to really demonstrate the value added brought by information and communication technologies is coming forth every day. So in closing the presentation, just some of the key points to take away. One, resilience is an overarching context which we have to build into how we operate. I think there is a space through fora like this for leveraging the diaspora in support of the CARICOM states, certainly as we move forward. The role and opportunities for the Inter-American institutions, and here I specifically want to speak to PAHO, because PAHO has been playing a very critical role in terms of the guidance to the region in the area of planning, understanding, and management of the COVID-19, and contributing through our core coordination group, where they sit along with the Caribbean Public Health Agency. And they also play a critical role in supporting the region in being able to access critical resources in a very distorted supply market. So we're looking at issues of bulk procurement. And I think also that what we are seeing is that the importance of these institutions to be flexible and agile at this time to respond to the needs. And finally, the whole matter of hemispheric humanitarian initiatives that we want to ensure that we're collaborating with. And I want to make a specific point here with respect to partnerships that we've been working on, including with the World Food Program, and a lot of the work that we're going to be doing in the logistics related to distribution of bulk procured items and donations will be undertaken hand in hand with WFP. So thank you very much for inviting us again to be a part of today's dialogue and to have the opportunity to contribute. I must express my apologies that I will have to depart very shortly. I do have another commitment this morning, but I have really enjoyed the opportunity to be a part of the panel, and I hope that the presentation that we've made has been beneficial. Thank you.
Merci beaucoup, Madame Elisabeth Kailé, pour cette présentation. Avant de partir, j'aimerais rappeler à tous les orateurs de bien vouloir soumettre le texte de l'exposé au secrétariat pour qu'on puisse les partager avec les pays membres qui ont fait la demande. La demande.
And we very much thank Ms. Riley for her presentation. The Ambassador Solis has the floor. You have the floor, madam. Mr. Chairman, both chairmen, for convening this very important session on the post-COVID resilience and the other major issues that we are broaching. There is no question that this session highlights the shared interest we all have as to the coordinated response, the integrated response that all of us member states understand must be provided as a response to the pandemic, rooted as that response must be on the 4 pillars of this organization. Guatemala very much appreciates the valuable input that we have gotten this morning. Ms. Riley, Sir George Aline, Mr. Ram, Mr. Otero, and our very good friend, Miguel Barreto. Thank you all. As to economic resilience, Guatemala shares the fact that this crisis must, of course, understand how terrible the impact is of the drop in subsistence income, particularly in the agricultural sectors. This has, as we've heard, gravely worsened poverty and indeed heightened extreme poverty. 80% of jobs in Guatemala are rooted in that sector, and we know that digitalization, electronic trade through the various platforms, of course, help, but the access to financing and credit remains key, and through that, one can hope to broaden one's presence on the market. This is a challenge, and the President of the Republic of Guatemala has recognized that, and that is why every 38 years there is a meeting held to check on protocols under the National Emergency Program for Recovery. We are also implementing various programs, including support for families that are in the informal sector and most in need of those people, including 4.5 million children through the school meals, and protection for jobs who are, of course, rooted in the small and medium-sized enterprises. We are bearing all of this in mind, and soft loans are being offered so that these can continue to function. We have also approved an energy subsidy that will be probably reaching some 2.8 million homes. As to disaster resilience in terms of natural disasters, Guatemala is among the 10 most vulnerable countries in the world in that regard. And as we evaluate the process in terms of our hope to remain economically viable and open post-pandemic, we're taking a very hard look, of course, at the heightened impact of these natural phenomena to which we remain vulnerable. Just recently, collapses, landslides, floods have affected 11 of the departments in the country. 2 people were killed and 167 persons had to be evacuated on an emergency basis. Bajo has enjoined us to look very carefully at what will occur in the hurricane season, because our response to the pandemic at that time may be seriously hampered by an increase in the level of respiratory illnesses, particularly, as we've heard, among people who have at the start a more vulnerable position because of their own disease burden coming in, the non-communicable diseases of which we've heard. And so we very much agree that economic cooperation must be ever more effective. It has to be multisectoral, and it has to be coordinated vis-a-vis the challenges of the pandemic. The Regional Center for Cooperation for the Prevention of Disasters in Central America and the Dominican Republic will certainly be an important tool in that box. We look also to ensuring that prevention, contention, and treatment of COVID-19 will be heightened in the 8 countries that are part of that system. That coordination is more important than ever, as Mr. George Aline rightly pointed out. Now, Chair, As to the resilience in the health sector, my government understands that a strengthening of our health infrastructure, which quite frankly has been historically neglected, absolutely needs to be focused on at the moment in all of the sectors of our society. We must render our health system more robust, more present. From the first sign of contagion, we had our Dr. Mate move to build 5 campaign hospitals in order to attend to people who most desperately needed and those who had to be quarantined. We planned strategically what our next steps should be, always looking at containing regional migration in order to contain the disease as best as possible. All of the ministries of our government are very much attuned to the need to work together. Our national strategy to control the spread of this disease based on our experience under SARS and MERS and others includes also social distancing, quarantining, in order that we can, as soon as possible, retake our ordinary life, our economic and otherwise in the country. As to resiliency regarding food security, as we've heard today, the data are grim. Some 14 million persons in the region are suffering hunger due to this pandemic, or may do. That clearly is an element that aggravates our fragile position in the first place. In the face of natural disasters and other challenges that we know, all of this bears heavily on food security. And so we are very grateful indeed for the offer of support that Mr. Barreto has offered us, and frankly, we'll take him up on it. He has spoken on behalf of the UN World Food Program, and we have well understood that the impact of the pandemic will seriously erode our being able to achieve our goals for the 2020 agenda. We know the 2030 agenda. We see that for the first time since 1990, we may indeed be seeing an impairment of the levels of world human development. President Fernando Yamate understands how critical it is then to bring together our sectors across the board in Guatemala, but especially, of course, with regard to the most vulnerable, the poorest zones. We have to understand the multi-causal nature of the problem. That being so, we understand how critical it is that we keep our eye on the ball, as has been suggested, right here at the OAS, this critical forum, taking into account food security, fighting poverty, fighting extreme poverty, inclusion, and labor security. We think this is a very opportune moment, a very timely moment for us to look hard to see how we can build on our achievements in Latin America. We have an Inter-American Declaration on priorities with regard to social development, equity, and social inclusion. We look to overcoming multidimensional poverty and closing the gaps, the multi-causal gaps of this, and boosting social development. This was adopted at the 4th meeting of ministers and high authorities of labor and social development here in the OAS, and this was held in Guatemala. And for the first time, the Guatemalan Plan of Action was drafted in order to overcome multidimensional poverty, in order to move toward an inter-American agenda of social development through 2019, that was last year. This should serve as a roadmap, friends. This points out to concrete goals that we can build upon, eradicating poverty in all of its forms, strengthening our systems of social protection, and girding hemispheric protection for our overall development. These concrete actions and more, plus the commitments we have undertaken within the context of our not only universal system, but our Latin American, our inter-American system, shows how we must build now more than ever post-COVID. Regional cooperation is an absolute must. At this joint session, Guatemala would like to announce that we will be presenting a draft resolution entitled the 2019 Guatemalan Plan of Action toward an Inter-American Agenda for Social Development within the context of COVID. That draft resolution will speak to the impact of the pandemic on our economies. We've spoken of it, on poverty, extreme poverty, on hunger, and food security and nutritional security in general. We will refer, of course, to other relevant issues that go to sustainable development, and we will underscore our commitment in this region to put an end to food insecurity and to promote sustainable agriculture, of which we have spoken so much for so long. We need also to buttress our measures of social protection in the COVID context in order to buffer the immediate impact on society such that we can rebuild people's ability to make a living, pull them out of the extreme vulnerability in which they find themselves, as the World Food Program representative has so aptly spoken upon. Guatemala has been speaking with a number of member states in that regard and has tapped them to see which might be interested in moving forward with us. We hope that they will rally round our presentation of that draft resolution, and at the next General Assembly of the OAS, I hope many of us will be behind it. This Inter-American Agenda for Social Development is essential, we believe, to frontally confront the pandemic and to move forward from here. Thank you very much, sir. Thank you, Madam Ambassador, says the chair. We appreciate that presentation. Allow me to remind the distinguished ambassadors that we do have a time constraint with deepest respect. We have a long list of people wishing to speak, some 20 at last count, so we ask for your understanding. And I now give the floor to Ambassador Carlos Jativa, the permanent representative for Ecuador. Mr. Ambassador, please go ahead. Ecuador, please. As the delegation of Ecuador propounded at one point, we are very pleased to have this joint session of the Permanent Council and, of course, of CIDI, the Inter-American Council for Interworld Development, because it is only in that manner that we can properly broach the impact of the pandemic situation on our 4 pillars of the organization. And we are very, very pleased to have listened to Ambassador Insanali in his very thoughtful introductory comments, and also yours, Ambassador Charles. And we very much appreciate the very, very useful and enlightening statements by our speakers this morning. At the special meeting of the 14th of May, the Permanent Council looked at how the pandemic was weighing on our countries. We understood that a robust and a participative democracy had to be one of the most important ways that we might respond. Democratic resiliency then is key, obviously also economic resilience, I should say. And we know that the worst recession of the last century and possibly of its entire history is being registered in my country. We know that it might affect even up to 8% of our GDP. This is extraordinarily worrisome. It means that 16 million additional people will fall into extreme poverty, very likely. These are people in extreme poverty, you understand, who cannot cover their most basic food requirements. I have just been informed that my camera is not on. I'm afraid, says the technician, the image comes and goes, distinguished ambassador. Is it on or not? I don't know. Well, let me go ahead in any event, says Ambassador Hativa. Go ahead, sir, please do. Very good. I was saying, for Ecuador, one of the most hardest hit countries in the region, we have seen, as I say, the worst possible economic factors. It was a perfect storm. The economy collapsed, and then we had the problem of the oil sector. $12 million were lost to the public treasury. So we were certainly very much behind in trying to respond properly to this pandemic. The government has therefore decided to focus on 4 principal objectives. Number 1, to strengthen our health system in order to boost hospital capacity. Secondly, very much focus on food security to all persons, particularly at the lowest income levels. Third, invest as a motor of the economy. And fourth, maintaining our financial system through dollarization, optimizing our public expenditures as best we could. As Mr. George O'Lean has rightly pointed out, we have earmarked $160 million to face the health crisis. We have reduced individual quotas for hospitals and clinics. This will free some $400 million, and we have also opted for a unified, a grouped public purchase of medicine and PPEs and others through COMISA. The crisis is affecting the most vulnerable, no surprise. And we have all of the information needed to understand how best we can improve our preventive measures among the indigenous populations, the Afro-Colombian and Afro-Ecuador communities, always boosting our ability to help people in those remote areas through more beds and more attention. We are focusing very much on intercultural rights and intergenerational rights. We have distributed more than 100 kits for food. More than 800 families have received, 8,000 families have received assistance through school meals, and more than 8 million Ecuadorians have been assisted. In the agricultural sector, we are seeking to ensure for the micro, small, and medium-sized producers to boost their crops, their cattle, and also fishing and mangrove activities, financial activities through our public banks in order to improve technology and productivity as best we could. In terms of preventive measures, we're looking, of course, to warehousing and to how best we can assist agricultural workers, first and foremost, to preserve their food security. We are distributing improved seed and reaching out in terms of our technical assistance. The government of Ecuador is thereby assisting all these sectors. We have earmarked $1.50 billion to preserve our economy, particularly focusing on the SMEs, trying to better manage our economy at this time of crisis and put greater order in our economy at this difficult time. We've also set up and drafted a humanitarian support law. This emergency post-COVID-19, or in the COVID-19 emergency, I should say, is based on a very strict protocols in terms of social distancing, of quarantining, of various medicines available. And we have, among others, measures taken measures in other areas of the economy, textile, timber, and numbers of others, important sources of labor in the country, in order to boost our economic resiliency. We have strengthening our campaign called Onwards Together, Juntos. We have launched improved digitalization for certain producers and artisans, particularly for women in business, offering virtual fairs, virtual training centers, and a number of other activities that we feel will make a difference. Bearing in mind the various different ecosystems, we've also set up a seed capital fund for innovative products in a variety of sectors, hoping that this will add value and generate jobs that will assist women in all of these different areas. Sectoral measures for the overall industry and reduction on the cost of certain raw materials or commodities, and reducing the tax on export are but a few of the measures that the government has taken to try to help. We have listened to the experts and looking hard at our own situation, understanding, of course, that we have zero tolerance for any sort of corruption, no tolerance for any type of corruption. We have access to independent justice and all levels of government. Now, we understand that we're not there yet. Much remains to be done, but I'd like to reiterate the position of my country in facing our common enemy. For that, we have to have multilateralism rooted in solidarity hemisphere-wide. The more interactive we are in our approach, the better off we'll all be. We look for a model of development that we can sustain, where our value chains and various other elements can continue to buttress our various sectors. We know what our vulnerabilities are. We know where we must do more. With the OAS, we've been working very much on a pilot project with the Executive Secretary of the Council for Integral Development, focusing on exports, taking into account the impact of the pandemic, and also a digitalization program to help everyone. We feel that the time is right to say that Ecuador has taken up the pro tem chairmanship of the RIAH, the Inter-American Competitive Network, under the leadership of the Vice Chair of the Republic. We are bringing together our private and public entities, and we hope to draw up a post-COVID agenda that will help us do more and do better in this area, taking into account what has been said here, the representative of the World Food Program. I think we can agree. This region has a great deal to contribute. We have a great deal of wealth to tap. We have a terrific geographical strategy. We have enormous natural wealth, mineral wealth, and a very high degree of entrepreneurship. And this pandemic cannot lay us low. We need to understand it is also an opportunity to tap the opportunities that are there to be tapped for us all. Let us reach a model of sustainable development that will be benefiting everyone and leaving no one behind. Let me close by saying that the proposal that was put forward by the distinguished ambassador for Guatemala, speaking of a social agenda, we of course support most fully. Mr. Chairs, gentlemen, I should say, both chairs, thank you both very much. I'm terribly sorry, says the chair. My mic was on mute. I apologize, says Ambassador Charles. Without further ado, I give the floor to the permanent representative of Honduras, Ambassador Mr. Luis Cordero. You have the floor, sir. Ambassador Charles, Ambassador Insanali, I thank you both for this wonderful idea of holding a joint session to give us a chance to assess the social and economic impact of the COVID-19 pandemic and allow us to position ourselves post-pandemic. We are facing one of the greatest challenges that humanity has faced in recent times. There is an economic and social collapse in many areas. And what can we say, as we have heard, about nutrition, about food security? We are assailed from all sides. And from the very first cases confirmed in Honduras, in my country, the government has focused on drafting an integrated approach. We put together an economic support system for the Honduran people to allow them to cover their most basic needs in an integral fashion so that we could together face the pandemic and its consequences. The main idea has been, of course, to focus on the most vulnerable populations and to help the people on the front line medically and producers. The president, Juan Hernandez, launched the agricultural support plan to ensure that the production of foodstuffs in Honduras could be safeguarded. We have offered loans to about $150 million to a number of productive sectors. We have supported the small and medium-sized enterprises with the help of the OAS. We have also, through the Honduran Bank for Housing, offered loans to about $450 million to those who have been hardest hit by this pandemic. This will trickle through to housing, to the small, medium-sized enterprises and agricultural production. The loans offered to clients will not entail interest rates. We're very much aware of how important it is to buttress our social and our economic systems so that when we are done here, we can move forward on stronger footing. We speak of resilience in the face of this challenge and future challenges. For that, we need to buttress our capacity to face these exogenous issues the best we can. And one of those challenges, of course, is this particular pandemic. Not least, of course, our meteorological challenges. Honduras is one of the most vulnerable countries to natural disasters, but we are absolutely convinced that if we think things through and work together, we can do better. To that end, of course, it is essential that we count on the support of all of the international organizations that can rally around us. The countries of SICA have understood how important it is to work together to buttress the input, or buffer, I should say, the impact of this pandemic and assist our societies in pulling together and doing better. We are very concerned, of course, by the fallout of this region. Central America continues to pose enormous challenges, hunger and poverty. That is why for SICA, the question of food security is not an intellectual matter. It could not be more structural. It could not be more vital. And all of the political and economic determinants must be looked at very hard to ensure that our populations have a chance. That is why this delegation is very pleased indeed to hear what the ambassador for Guatemala has announced, and we look forward to working with her on that draft resolution on social development. Let me also say that at the end of yesterday, close of business yesterday, Honduras reached 950 positive cases, including our president and his first lady, confirmed cases of COVID. They shared their positive, the positive result of their trial with the population. The first couple has absolutely maintained the necessary distancing in order to ensure that people around them could be defended as best as possible or protected. I thank you, Chair. Thank you very much. Thank you, Ambassador for Honduras, and I now give the floor to Ambassador Fernando Sines, Ambassador for Brazil. You have the floor, sir. Thank you very much for giving me the floor. I greet the Secretary General, Assistant Secretary General, and say that we're very pleased indeed for the timeliness of these meetings. And I've heard you, Ambassador Charles, reminding us in speaking of timeliness, actually our attention to time and the length of our interventions. I would just like to remind us that it is essential that we do what we can to bring everyone in this kind of meeting. This joint meeting is very welcome indeed. I am grateful for the initiative to bring the Permanent Council and the CD Council together. And I am very pleased to have listened to everyone's statement thus far. This important matter that we're addressing, without a doubt, poses an extraordinarily daunting problem. This is one of the strongest external shocks that any of our countries has faced in certainly their lifetimes. The impact on our individual economies, on our employment levels, and our ability to pick up from here are all very, very worrisome. We have lost opportunities, a loss of a living for hundreds of thousands of families. And so I think it's clear that we're in for a very tough post-COVID era. Therefore, post-COVID resilience is very much to the point. And there, I would point out the fact that the debate on resilience, even during the pandemic, is essential. During the pandemic, as well as post-pandemic, resilience is the essential ingredient. We've got to find a way to think out of the box, to assist our peoples to take up the best possible position in the face of these terribly unexpected challenges. An integral response, a comprehensive response, is equally essential. Back in February, my country adopted legislation to try to better face this situation, including curbing of the spread and social distancing and marshaling of certain goods. In March, we put forward guidelines for the federal entities that were involved in containing the virus, and the measures recommended from abroad were shared with each state in the Union. Brazil is enormous, as we know, with various different geographic characteristics, and it was important that measures being promoted be adapted to local conditions. It goes without saying. The federal government is tracking the risk levels on a daily basis and is supporting states and townships as needed, materially and via the support of personnel. The more than 1 billion reais have been earmarked for the purchasing of protective material and other inputs needed in the medical context. Hundreds of different entities, of course, are involved here. And the projects that are being worked on seek, of course, to boost our scientific understanding and our positioning to better face these challenges. You can look to see what we have been doing through the OAS portal. Ladies and gentlemen, we are looking at a special tax regime in order to free up funds to fight this pandemic above and beyond the amounts that had been earmarked earlier. We're talking about 15% of those sums, talking about $26.26 billion that have been earmarked to certain states and townships in order to compensate the drop in the payment into their coffers, into their treasuries, and any further taxes have been momentarily suspended. We also have offered emergency assistance, financial assistance to some 54 million workers in the informal sector, about 60% of the minimum salary, the minimum wage in Brazil. We're also helping women and men who are heads of families through our various programs. We're working, therefore, to buttress the economy, and we have, in fact, allowed a momentary break in the labor contracts that have been signed up to 90 days, taking into account the social impact in question. We look also to the small and medium-sized enterprises, and we're trying to boost the assets of private companies by also helping the secondary levels. And as much as we're at a historic level for credits, we have expanded credit available and are looking at special measures destined to the population that is hardest hit. Free school meals to some 40 million students is maintained, of course, and a help among the poor and traditional communities. I am coming to the end of my statement, and let me simply say that Brazil feels awareness of our resilience in the post-COVID nature must include our determination to go back to normalcy. We have to understand that this isn't going to be a one-time effort. We must continually be ready to adapt, to transform. There is no clear line between the before and the after here. And we believe that most likely it is during our struggle, as the pandemic continues to affect us, that we'll come up with valuable tools to move forward. That is our hope. Let us understand that we're not building from zero. We need to build on what we have, and we need to be flexible. And I thank you both very much indeed for the privilege of being at this important debate and to allow you and allow us to learn more. Thank you.
Pour cette présentation. Maintenant, je vais accorder la parole au dernier coordonnateur régional qui n'a pas.
Give the floor now to Noah Lynch from CARICOM. You have the floor, sir.
Good morning, Chairman, Secretary General, Assistant Secretary General, permanent representatives, alternate representatives, and to all the distinguished panelists that we have this morning. The CARICOM member states of the OAS welcome the convening of this joint session of the Permanent Council and the Inter-American Council for Integral Development, CIDI, under this very important theme of building resilience in the wake of COVID-19. The convening of this meeting is timely and provides a valuable outlet for productive dialogue on the serious issues that confront us all. The illustrative presentations made by the representatives of the World Food Programme, PAHO, AICA, SEDEMA, and Justin Ram Advisory and GSEC highlight the precarious scenarios our countries face today. The COVID-19 pandemic has precipitated a series of unprecedented shocks onto the society, our health systems, our economies, and our government systems all across the globe. The Economic Commission for Latin America and the Caribbean, ECLAC, has forecast that in Latin America and the Caribbean, the coronavirus pandemic, through both external and domestic factors, will lead to the worst economic contraction that the region has ever experienced. The contractions are expected to surpass those seen in 1918 and in the Great Depression of 1930. As a matter of fact, the initial projected contractions as forecast by ECLAC have not all been revised downward, spelling out dire economic consequences for all regions of this hemisphere. For the Caribbean, the fall off in the demand for tourism services has made the situation even more dire. This ominous prediction is coming on the heels of 7 years of low economic growth for the Caribbean. The pandemic has also revealed inequalities and inequities that will compromise the achievement of economic and environmental sustainability as envisioned in the 2030 Agenda for Sustainable Development. It has manifested the multidimensional nature of the security challenge for all members of the OAS in terms of economic security, health and human security, food security, and environmental security. Unfortunately, in this particular case of the Caribbean region, the pandemic has compounded many of the lived realities of our countries and exposed the persistent systemic and structural vulnerabilities to threats posed by climate change and other exogenous shocks. The small island and low coastal level states of the Caribbean are acutely susceptible to climate change and its adverse effects, including, of course, sea level rises, increase in intense hurricanes, drought and flooding, high transactional costs arising from remoteness, vulnerability to economic and fiscal crises, as is evident from the hugely demanding effects and damaging effects of the COVID-19 and the humanitarian problems that are caused by natural disasters and external events. The reality is that for some of our tourism-dependent economies, the pandemic has created challenges and exacerbated existing ones. We have faced the interruption in revenues from tourist arrivals, pressures on the supply chain in agriculture, construction, and manufacturing. And for countries that trade mostly in commodities, the pressures created by COVID-19 has been equally as severe. To compound this reality, Chairman, our countries are already spending between 2% and 5% of our GDPs to mitigate the impact of this crisis. Our governments have prioritized the health and well-being of their populations, focusing on saving families and saving households. This effort has come at a very high cost to our sub-region, already susceptible to to other exogenous shocks. There's absolutely no doubt that the COVID-19 pandemic will lasting impact on the welfare of our countries and the region for years to come. Moreover, sirs, the economic impact of the pandemic will directly affect response and recovery efforts should our country suffer weather-related disasters. In fact, the April forecast by the Colorado State University predicts above normal activity for the 2020 North Atlantic season, and the region must now start preparing for the very real inevitability of having to manage two disruptive events concurrently. It is therefore imperative that the OAS immediately prioritize collective and concerted action to overcome the persistent underlying vulnerabilities of member states across the hemisphere, which have been fully exposed by this pandemic. The development pillar and the multilateral cooperation agenda of the OAS has than before. Chairman, in this regard, CARICOM wishes to especially commend the Executive Secretariat for Integral Development, SEDI, for its nimble efforts to refocus its work plan to develop initiatives to assist member states with addressing the challenges confronted by the COVID-19 pandemic. SETI is to be particularly lauded for its efforts to strengthen micro, small, and medium-sized enterprises at this sector who have been harshly affected by the crisis, and their recovery will be critical in a post-COVID-19 environment, given their important role in job creation. SETI has introduced programs to help MSMEs adjust to the new reality through webinars and initiatives aimed at digitization and the development of platforms for e-commerce with a view to building increased competitiveness. CARICOM also commends the use of science and technology to help OAS countries build resilience, particularly in the areas of disaster preparedness and management and health and biological threats. The Hub on Technology Transfer and Commercialization Initiative, for example, is geared to help young scientists and entrepreneurs use technology to develop innovative products and services. This one such project is to be encouraged, as initiatives like this are especially important at a time when it is evident that our economies need to diversify and that our youth will need to seek alternative avenues of employment. CARICOM welcomes discussions on health resilience and underscores that the response to the COVID-19 pandemic in the Americas must include chronic disease care, as 1 in 4 persons are at increased risk due to underlying non-communicable diseases. This is particularly worrying for the Caribbean region, where the prevalence of NCDs is exceptionally pervasive. Moreover, stay-at-home measures, disruptions in provisions of healthcare services, as well as the fear of attending care facilities have resulted in reduced elective clinic visits and lower access to examples like renal dialysis, cancer care, and delays in high-priority treatments for patients with NCDs. Lower access to care and disruptions in healthcare services puts patients at higher risk of complications and deaths from diseases, which are easily treatable, and health systems must find a way to respond, or we will be faced with a parallel epidemic of preventable deaths of persons with NCDs. The CARICOM region further wishes to underscore that it is vital that the contributions to institutions and organizations that play an important supporting development role are maintained during this current pandemic. At this critical juncture, any shift or decrease in these areas will translate into shortfalls in these needed areas. Any reduction at this point would cripple vital development programs at a time of increased challenge to global health, security, and stability. Our CARICOM community is encouraged by programs being led by AICA and other agencies to promote food security by increasing domestic production while strengthening agricultural resilience and sustainability. Increased professional training to foster the effective use of technology tools to drive the agricultural sector is also welcome. Concomitantly, we recommend collaboration with the education sector to engage and train our youth in agroscience and agricultural production. The strengthening of the agricultural sector in the Americas is paramount, given its decisive role in post-COVID-19 economic recovery and in the preservation of food security both during and after this coronavirus emergency. Chairman, all countries of the hemisphere have announced important measures to address the challenges presented by COVID-19, but these measures must be reinforced by an expanded fiscal space for us in the Caribbean. It is essential that all countries have access to financial resources based on the flexible support of multilateral financing organizations, accompanied by low-cost credit lines, debt servicing relief, and possible debt forgiveness. In this regard, there will be no progress without international cooperation and solidarity. The effects of COVID-19 pandemic have accentuated the concept of economic vulnerabilities, as defined as the insufficiency of resources and capacities to withstand the adverse impacts of crises in general and of natural disasters and pandemics in particular. International discussion on the inadequacy of the per capita income criterion for determining countries' preferential access funding needs must be fast-tracked. Multilateral agencies are encouraged to create specific instruments that incorporate the vulnerability criterion and that can support states at different stages of the pandemic. Exceptional measures are required to confront an unprecedented crisis. As the current chairman of CARICOM, the Prime Minister of Barbados, the Honorable Mayor Morton has stated, this is not a crisis that countries can face alone. At this time of global crisis, it is time to rethink and give meaning to international cooperation, new meaning, and the fight against poverty. Chairman.
Merci.
Thank you very much to the chair of CARICOM, or the CARICOM group. I'd like to give the floor to Peru. I would please ask our next speaker to limit his remarks to 7 minutes. We have a very long list of delegations requesting the speaker, or to speak rather, and I don't want us to have to go on without interpretation. So the permanent representative of Peru is recognized. Ambassador, you have the floor. Thank you very much. Co-chairs, I am going to reduce my remarks as much as possible. The delegation of Peru thanks the Permanent Council and CITI for convening this meeting. We need to look at policies and development and other issues to go forward. We thank our panel of experts, and it allows us to see the shared challenges we are facing, and also to see the imperative of being more effective in international cooperation and in our measures. Latin America and the Caribbean, even before the pandemic, was facing food insecurity. But now the situation has worsened, and it means that people are facing greater challenges to feed themselves and to actually earn a living. The health measures, of course, are affecting the agricultural sector. So we need to have measures to be able to counter this negative impact. The Peruvian government has taken measures to stop the health measures from actually leading to greater food insecurity. During the quarantine, we have given facilities to SMEs to keep up their production, especially in the farming sector. We've also been supporting poor families and those families that don't have steady income. We have done everything possible to make sure that markets have basic products. We have also fought against speculation of prices, and we are financing also different traveling markets. We have been supporting agrarian markets and also logistical chains. And so many farmers have received this help. We are also giving direct financing to small farmers and reduce the interest on loans, as well as forgiving loans. We are also creating temporary jobs in the agricultural sector. Chairs, in sum, we are all taking integral measures to stop a food crisis. Thus, the government of Peru thanks ICA for the efforts undertaken during this crisis. We also thank the UN, the WFP, and other UN agencies to provide food to needy families and migrants. We are also designing an initiative to provide food through schools. This will allow us to face this challenge in a successful manner. We thank also the OAS for its efforts, and we need to continue to work together. Only through cooperation will we be successful in facing off this crisis, as well as the complex repercussion it is going to have during and after. Thank you very much, chairs. Thank you very much to the ambassador. We have Nicaragua, then US, then Colombia, Bolivia, and Mexico. Just so you're ready. The permanent representative of Nicaragua has the floor. Ambassador Luis Alvarado, you have the floor, sir. Thank you very much, Chair. We thank you for convening this joint meeting. We would like to warmly greet permanent representatives, observers, special guests. We have taken note of your presentations. We see that economic growth has been halted by the pandemic, in addition to other crises such as food insecurity, wars, natural disasters, energy crises, climate change, cyclical economic and financial crises. This has affected international security and peace, health, trade, and the worldwide economy. Among other challenges we face, we see we need to build a new economic order that is more equitable, because our globalized world cannot continue because we have not addressed inequalities. Another challenge is to build resilience in the face of the COVID-19 pandemic. So Cuba, Nicaragua, and others have expressed that they condemn the aggressions they are facing. And we have stated this before the free world. These illegal policies violate international law and also are halting the development of our resilience to be able to effectively address the pandemic, and has medium and long-term effects. The people of Nicaragua calls for this aggression to stop. In the last decade, natural disasters have caused billions of dollars in damage and have affected thousands of people. This, according to the FAO. With climate change, extreme meteorological events are becoming more usual. The most vulnerable people are those who are impoverished and face food insecurity, and usually they are in the farming sector. With regard to the COVID-19 pandemic, we see that these groups are very, very vulnerable, and we are doing different simulations in Nicaragua with SINAPRED. And so this will help us to also develop our integral emergency plans to address natural disasters such as floods, as well as the transmission of COVID-19. We are working with ICA. The agricultural sector in the Americas will play a key role in our recovery after the pandemic, and this ensures our food security now and later. We see that data on malnutrition and food exports are not looking good. According to the World Food Program, the impact of the pandemic in Latin America and Caribbean will mean that 14 million vulnerable people will now face serious food insecurity. This is a challenge for all countries in the region. So social programs are key. The worldwide crisis as a result of the pandemic has meant that governments need to give universal access to health systems. It shows that it's important to protect the environment, to have social programs, and that we need to build resilience and have measures to come out of this crisis as soon as possible to stop poverty and food insecurity. So cooperation and solidarity among states is key to fighting this scourge. Nicaragua will continue to build its resilience and public policies to strengthen our free universal health system, protection of life, food security, this in the face of natural disasters. We will continue to promote the unity of our people. So together, God willing, we will come out of this COVID-19 crisis. Before we conclude, we want to express our solidarity with the government of Honduras, and we hope that the president and his wife recover soon. Thank you very much, Chair. Thank you very much, Ambassador. And thank you for being brief. I hope others will follow your example. Ms. Christina Buff, the representative of the United States, has the floor. You have the floor, madam.
Has been kicking me out a couple of times, so thank you for allowing me to take the floor. Good afternoon to all, and first I'd like to take the opportunity to thank the presenters for their helpful insights on the numerous challenges that member states are facing in this pandemic, and you've given us a lot to consider as we move forward. The United States appreciates the focus of this session, which is on building resilience. Whether we are talking about the pandemic, economic downturns, or natural disasters, building resilience is an essential component of member states' ability to respond to and recover from these crises. I'd like to take a few moments to highlight a few of the themes where the United States is actively promoting resilience. With respect to economic resilience, we've taken unprecedented fiscal, monetary, and financial stability actions to bolster the US economy and help other countries weather the economic crisis. The United States is the top global provider of COVID response aid, which has reached $1 billion. And we have also backed international financial institutions' disbursements of billions in emergency loans. The United States, in the recovery and response to COVID, will also continue to lead through our Women's Global Development and Prosperity Initiative that supports women around the world as drivers of the economic recovery from COVID. We must use this opportunity to ensure that we build economies that lift up all of our citizens. According to the White House Council of Economic Advisors, annual global GDP could increase by as much as $7.7 trillion if countries address 5 foundational areas of legal reform impacting women, such as women's ability to access institutions, to build credit, own and manage property, travel freely, and work in the same jobs and sectors as men. We also support increasing the capacity of small business development centers to provide free or low-cost counseling to all MSMEs that want it, and expand loan guarantee programs to encourage banks to lend more to MSMEs. Digitization is an important piece of doing business, and we want to commend the OAS's efforts to help our region come online in that regard. The US government at the very highest levels, along with many non-governmental US stakeholders, is focused intently on the food security implications of COVID. Considering the last few months, it is clear a practical, results-oriented discussion is needed on how to build resilience into food systems in times of crisis to avoid system breakdown. While the crisis will end, others will follow, and it is imperative our food systems be positioned to adjust and adapt to similar crises. Given the challenges we face, all tools for improving food systems should be considered. Let's be innovative and bold in our efforts to build back better. We must work to expand options and opportunities for countries to determine their own solutions within their local contexts, not on prescribing outcomes. We firmly believe that agriculture and food production will present a key lever towards economic recovery and sustainable growth. And in this respect, we appreciate the role of ICA and its work in addressing these complex issues in the region. Finally, with respect to natural disasters, we support the OAS General Assembly's call for the OAS to review the instruments and practices of the OAS on natural disasters. We hope this comprehensive process will identify the value add of the OAS to enhance collaboration for the benefit of OAS member states facing or responding to natural disasters, and realign political and technical bodies of the OAS to accomplish this critical role. In addition, the OAS needs to identify its comparative advantage and best value it can play for the institutions of the Inter-American system, sub-regional and international partners, OAS member states, and permanent observers in response to natural and other disasters. For example, there's a clear nexus between the OAS's comparative advantage on economic growth programming and bolstering regional resilience following disasters. As such, the United States is pleased to support the OAS as it implements a $500,000 project to build resilience to natural disasters in the Caribbean tourism industry. Among other things, this project will facilitate community emergency response training for tourism providers across the Caribbean. Focused OAS projects such as this promote resilience and ensure that economies in the region are able to recover more quickly from disasters. In closing, we want to emphasize the importance of the OAS's comparative advantage across these areas and the need to focus the institution's response on those areas. We urge member states to keep in focus the role that the OAS is capable of playing in response to this pandemic. Spending our valuable time and limited resources on issues outside of the OAS's remit will only hinder the organization's ability to respond meaningfully in the face of this crisis. Thank you very much.
Merci beaucoup, Madame la représentante suppléante. Maintenant, nous accordons la parole à notre collègue des Bahamas, ambassadeur Sidney Collet. Excellence, vous avez la parole.
Presentations. They were so comprehensive and so data-driven and well laid out, addressing the issues, that I think this entire organization owed that panel a great debt of gratitude. I congratulate them. I hope, Chair, through you, that those presentations can be shared with member states. Let me also say, Chair, that my brief intervention is in no way a substitution for, but only in addition to, the excellent and comprehensive presentation already made by Chair of the CARICOM Group, Ambassador Lynch. Last September, having suffered the worst national disaster in its history, courtesy of a Category 5 Hurricane Dorian, the government of the Bahamas was thrilled to propose a resilience-based theme of the 50th OAS General Assembly, which the Bahamas had offered to host. However, due to the widespread economic impact of COVID-19, the 50th General Assembly had to be postponed for June and is now temporarily rescheduled for later this year in Washington, D.C. The Bahamas was very pleased to see that the subject of resilience has been brought to the forefront to be discussed in this forum. The need to build resilient economies, social and environmental ecosystems are even more relevant today than it was just over 4 months ago, when the first COVID-19 case was discovered in the United States, and weeks later, became rampant throughout the region and a global pandemic. To date, more than 400,000 people worldwide have died from COVID. This pandemic has crippled our economies, especially those heavily dependent on tourism, challenged our healthcare system as so well outlined by Sir George Arlene, and heighten our socio-economic vulnerabilities. To add fuel to the fire, on June 1st, the 2020 Atlantic hurricane season began, compounding an already exacerbated situation for countries in the hemisphere, but more particularly for countries in the Caribbean Sea. Hurricane Dorian, as you are aware, ravaged two of our larger islands and economic centers just 9 months ago, leaving a wake of destruction in its path, causing economic losses estimated at $3.4 billion US. Many Bahamians are still grappling with the loss of many, many lives, homes, businesses, jobs, and critical infrastructure. With the onset of COVID, we were forced to close our borders, leaving us faced with double extreme shocks to our economy. Due to the combination of Hurricane Dorian and COVID-19, the Bahamas expects to see a $977 million US revenue shortfall, resulting in a $1.3 billion US deficit during the fiscal season. These factors has made it even clearer how important it will be for us in our various countries in the region and as an organization to focus on building resilience in such a rapidly changing environment to help mitigate the impact of exogenous shocks. The Minister of Finance of the Bahamas last week, in its contribution to the budget debate, presented a prescription plan called Resilient Bahamas, a plan for restoration, to lead our country from crisis to opportunity. The plan involves choosing targeted investments for public health, enhanced social support, food security, climate change mitigation and adaptation, infrastructure building, job creation, and small business growth and development. The Bahamas commends the OAS for bringing these issues to the fore for further discussion. We commend the Executive Secretary for Integral Development for the work done so far to assist member states in facing present and emerging challenges due to COVID. The Bahamas is especially pleased with the continued support for the Small Business Development Center and the digitization plan for micro, small, and medium-sized enterprises, which our SBDC is actively engaged in adopting. Bahamas is also hopeful that in the second phase of digitalization, we can partner with the OAS to create an e-commerce platform that will serve as a marketplace for local entrepreneurs to sell a variety of authentic Bahamian products. This initiative would afford hundreds of entrepreneurs an online presence, which is critically important in light of the ongoing pandemic. In conclusion, Chair, like the Bahamas, I am certain that member states have drafted their own plans and strategies for the way forward in the wake of COVID-19. As we transition from vulnerability to resilience, we call for a continued strengthening of multilateral cooperation and partnership to foster resilience building, which will help avoid or at least lessen the impact of internal and external shocks. We look forward to continued discussion and focus and meaningful follow-up with these pressing issues. Thank you, Chair.
Merci beaucoup, ambassadeur. Maintenant, nous accordons la parole au représentant permanent de la Colombie, ambassadeur Alejandro Ordóñez. Excellence, vous avez la parole.
Very much, Mr. Chair. I have taken to heart your request that we take.
Empezar agradeciendo a usted y al embajador Incinali por la convocatoria conjunta y a los expertos invitados por sus valiosas presentaciones, las cuales nos muestran a los estados en panorama de cuáles deberían ser las acciones que pensemos y tomemos en respuesta a la pandemia, que nos encaminan a la recuperación tanto económica como social de los estragos causados por ella y sobre todo que nos encaminan a fomentar sistemas económicos, sociales y ambientales más resilientes. En Colombia, creemos que para salir fortalecidos de la crisis, no solo es necesario mirar y pensar hacia el futuro, sino que también es importante aprender de las lecciones del pasado. En este caso, donde el intercambio de experiencias y buenas prácticas para reducir al máximo los impactos de la crisis económica y de la salud pública y así preparar el camino para una pronta recuperación. El presidente Iván Duque y su equipo de gobierno han tomado decisiones para proteger la salud pública con el apoyo de un comité científico de expertos y sobre la base de unos indicadores objetivos que determinan cómo avanza la epidemia y cómo se está moviendo la población. De igual forma, los programas y planes y proyectos que están en curso incorporan un enfoque diferencial y étnico con énfasis en la población vulnerable, dimensión territorial y compromiso con el respeto a los derechos de la población migrante. Pensando en el futuro y en la recuperación de las actividades económicas, el gobierno se encuentra en el proceso de planeación y diseño para la ejecución de protocolos, lineamientos y estrategias que permitan un levantamiento de la cuarentena que sea escalonada, responsable e inteligente, con miras a la reactivación progresiva de los sectores económicos. En este sentido, el presidente ha mantenido su compromiso con la búsqueda de un equilibrio entre salvaguardar la salud de los colombianos, proteger el sistema de salud pública y estimular recuperación responsable, sostenida y progresiva de la vida productiva. Lo que se busca es conservar los avances en materia de equidad y reducción de la pobreza alcanzados en las últimas décadas. La protección del empleo y el apoyo a los más vulnerables ha sido un eje central de la respuesta del gobierno colombiano a la pandemia, el cual ha realizado una inversión de cerca de 117 millones de pesos, equivalentes a 31.5 millones de dólares y alrededor del 11% del Producto Interno Bruto en salud, auxilios directos a la población más vulnerable, medidas para proteger el empleo y recursos para entidades territoriales. Por otro lado, el programa Colombia Responde incluye un grupo de herramientas financieras que buscan ofrecer soluciones a las principales afectaciones por el COVID-19. Problemas de liquidez, dificultad de acceso a insumos y materia prima para procesos de manufactura y comercialización, y disminución en la oferta internacional de productos e insumos importables, entre otros. Con el apoyo del sector financiero, el gobierno busca llegar a empresas de todo el país con una oferta especializada que ofrece condiciones favorables a los diferentes sectores empresariales. Estos beneficios podrán ser percibidos en tasa, plazo, amortización de capital y periodicidad en el pago de intereses de forma mensual, trimestral o semestral, periodos de gracia desde 6 meses hasta 3 años. Dentro de estas herramientas se destacan las líneas de crédito del Banco de Comercio Exterior de Colombia, las cuales están dirigidas principalmente a las pequeñas y medianas empresas de varios sectores económicos a fin de que puedan continuar sus operaciones. En cuanto al sector del turismo, el Ministerio de Comercio, Industria y Turismo, con el apoyo de ProColombia y del Instituto Colombiano de Normas Técnicas y Certificación, se encuentra trabajando en la certificación o sello de bioseguridad, certificado COVID-19 bioseguro, el cual tiene principales objetivos: generar confianza entre los viajeros y consumidores, minimizar los riesgos del contagio del virus bienvenidos e incentivar el turismo en el país. Esta certificación, que es de carácter voluntario, se basa en los criterios de los protocolos de bioseguridad contemplados en la resolución de 666 del 2020 y en los protocolos específicos de cada uno de los sectores de la cadena del valor del sector turístico. Tendrá una vigencia de 2 años y el Ministerio de Comercio, Industria y Turismo llevará un registro de los prestadores de servicios, atractivos y destinos turísticos a los que se les otorgue el sello. Quisiera terminar, señor presidente, reconociendo nuevamente la importancia de contar con estos espacios donde entre todos los Estados miembros de la organización podemos pensar en el futuro de nuestra región y encaminarnos a buscar una respuesta global que sea cooperativa, coherente, basada en la ciencia y centrada en las personas. Muchas gracias, señor presidente.
Merci, Excellence, pour cette présentation et merci aussi de votre collaboration. J'accorde maintenant la parole au président permanent de la Bolivie, l'ambassadeur Jaime Aparicio. Monsieur l'ambassadeur, la parole vous est accordée.
Secretario adjunto, agradezco a los presidentes de los 2 consejos y a los expertos que hoy
I want to thank our panelists for having provided such important information. Now, I wanted to now mention what my government is doing and also weigh in on what we think the OAS
está trabajando en temas estructurales.
No se me prende el micrófono, entonces Kelly lo tomó el último y aquí ahora cada vez que pico, and I just refreshed, by the way.
Ha sido una prioridad al mismo
Si quieren lo vuelvo a
que
hacer.
ha implicado un gran reto.
¿Cómo cierro? ¿Cierro todo?
Devastado que se encontró con el
¿Tú crees que
sistema
pueda
de
yo volver a
salud,
entrar
el sistema
a esto?
institucional después de 14 años de descuido en el campo de la salud?
Ok.
Que coincidíamente con los años de mayores ingresos de nuestra historia, debido a los altos precios internacionales de nuestros productos.
Je demande à l'appui technique de voir si on peut contacter l'ambassadeur Aparicio.
I'd like to.
En attendant, sa reconnexion,
We're hoping to reconnect with the ambassador. Ambassador Aparicio,
solicitar la palabra nuevamente,
would you be so kind as to ask the floor once more? Ask for the floor once more. Bolivia, please.
Ahí lo escuchamos, embajador.
We can hear you now, Ambassador. The ambassador for Bolivia, Jaime Aparicio, has the floor. The interpreter points out that the ambassador for Bolivia is not yet connected. The English channel is awaiting connection with the ambassador for Bolivia. You hear me? The interpreter is still awaiting connection with the ambassador for Bolivia, hoping the English channel can be heard. Yes, and continues, and more investment shall have to be made in health and education, and there will have to be much greater attention paid to digital challenges that are necessary to move forward. Afraid the connection has been interrupted yet again. The interpreter regrets.
Refresh. You have to refresh.
Will you take it then? You take it.
I'll try.
But it's the technician is pointing out that there are connection problems. Perhaps the technical team can get in touch with him. Meanwhile, says the chair, I will give the floor to the ambassador for Mexico, Luz Elena Baños. Madam Ambassador, you have the floor.
l'ambassadrice, à la représentante intérimaire de l'Argentine, Madame Graciela Almada. Madame la représentante intérimaire, vous avez la parole.
Embajadora, si puede solicitar la palabra porque no la tengo en la lista.
D'accord, si Madame, si la représentante intérimaire n'est pas disponible, on accorde la
La
parole.
representante argentina no está en la lista.
D'accord. On accorde la parole à la représentante suppléante de la République d'Haïti, Madame la conseillère Cindy Dalcé. Madame la représentante suppléante, vous avez la parole. Si Madame Dalcé n'est pas présente, à la représentante intérimaire de l'Argentine. Maintenant, nous accordons la parole à la conseillère représentante suppléante d'Haïti, Madame Cindy Dalcé. Madame la représentante suppléante, vous avez la parole.
Sans précédent qui a eu des répercussions considérables sur les systèmes de santé, les économies et les systèmes gouvernementaux à travers le monde. L'Amérique latine et les Caraïbes ont particulièrement été anticipée a été examinée pour limiter la population carcérale. Une commission multisectorielle de gestion de la COVID-19 a été mise sur pied. Une somme a été versée aux plus vulnérables et le ministère
myself of this occasion to recognize the wonderful job done by Ambassador Riyad Insanali at the head of CIDI. And I also want to thank the chair of the Permanent Council. Thank you very much. Thank you to the ambassador. I'd like to offer the floor to the alternate representative of El Salvador. Sir, you have the floor. Thank you very much, Chair. Esteemed Ambassador Leon Charles and Ambassador Insanali, Chair of the Inter-American Council for Integral Development. I thank you both for organizing this meeting. I'd also like to thank all of our speakers for their valuable and worthwhile presentations. Our region has been very vulnerable to the effects of climate change. It has caused floods, hurricanes, and other natural disasters, which seem to grow worse by day. This states we need to strengthen our institutional framework to be able to address the effects thereof. But the COVID-19 pandemic has really gone beyond anything we could have imagined and is underscoring all of our vulnerabilities. 3 months alone have put into risk all of the progress we have made over decades, worsening poverty and food insecurity. So we need to have resilience plans to address the different repercussions of the crisis. Also, we are beginning the hurricane season now, which usually hits us hard. So we need to get ahead of the curve. We need to strengthen our national prevention and mitigation plans in order to create resilience. What we want is to mitigate as much as possible the impact of these natural disasters. Chair, El Salvador is facing a situation without precedent. In addition to the COVID crisis, we have the climate crisis. So we have two emergencies we are dealing with, not only a health crisis, but we have 12,000 people who are homeless now. We have lost homes. We've had mudslides. It's affected our agricultural sector. We've had floods. So in that sense, food security is compromised. We need to undertake action to be able to counter the impact on the most vulnerable segments of our population. For this reason, we welcome the initiative that was mentioned by the permanent representative of Guatemala, and we hope that we will have other proposals made. Now, given that there is the possibility of new waves of COVID-19 transmission, we need to strengthen in a constant way our health system. In my country, one of the challenges has been to recover a health system that has been neglected. We need to modernize it, and we need to have 30 intensive care beds, but we've even gone from 30 to 100 and some, but we need at least 1,000. Now, we are trying to also give support to the neediest families. We have been providing them assistance. We have been also paying for basic foodstuffs. We have done this for 2.8 million families, and we have allocated funds to different city authorities. We need to strengthen our national banking system so that they can support both the informal and formal economy. We need to strengthen our SMEs. We have distributed different subsidies for credit programs, which have a 1-year grace period. These credit lines are offered at 3% and even offered to those who work in the formal economy, or rather informal economy. So we need to take into account these people when we try to reactivate our economy. We have been working also with the Office of the First Lady to offer health assistance, food assistance, and different measures to ensure the right to education during the pandemic. We think that we need to have an exchange of ideas so we can be more innovative. I think that with the Permanent Council working with CEDI, we will be able to do this. This will help us have better capacity to implement measures to build resilience in the context of our next General Assembly. Thank you very much, Chair. I thank the delegation of El Salvador. I now give the floor to Chile, but before I do so, I want to tell delegations that we have run out of time. We had allocated 4 hours for this meeting, but we have a long list of delegations that have requested the floor. So we are going to continue without interpreting because, as you know, our budget is very restricted and we cannot pay interpreting after 2 o'clock. So at 2 o'clock, we will be cutting off the interpreting. Ambassador from Chile, Hernan Salinas, you have the floor, sir. Thank you very much, Chair. Chair of the Inter-American Council for Integral Development, Chair of the Permanent Council, I thank you for convening this meeting. We also thank our presenters for their presentations, of which we have taken note. The COVID-19 pandemic has meant that we are now debating the effectiveness of multilateralism as a catalyst for peaceful coexistence. I think that we need to reflect on this because it is a point of inflection for the international system. COVID-19 may have begun as a health crisis, but now it has led to other kinds of crises, both social and economic. The coronavirus pandemic not only threatens people's health and lives, but also it is affecting migrants, women, older adults, but it is putting at risk people's income, livelihood, employment, and the existence of large enterprises as well as SMEs. It is fundamental to be able to help families and provide liquidity because there are families, people who need protection. We know that this is a very complex moment, that families are having great difficulties, that we need to offer capital. Our commitment and our duty is to support our people so that we can overcome this terrible moment and be strengthened when the worst part of the health crisis is over. Chair, we are living through exceptional moments, so we need exceptional measures. The interpreter apologizes, but it is now 2 o'clock, and I have been told I need to turn off my mic. I thank you all very much.
Y proyectos. Aquí no estamos enfrentando un dilema entre la salud y la economía. La primera prioridad de nuestros estados debe ser la protección de la salud y la vida de todos. y para ello es necesario asegurar el abastecimiento de bienes básicos como alimentos y medicamentos y el abastecimiento de servicios básicos como electricidad, agua y telecomunicaciones. Esto es un deber del Estado. El momento de actuar es ahora. La familia, los trabajadores y las empresas lo necesitan ahora. Es por ello que el gobierno de Chile presentó esta semana, en adición a medidas ya adoptadas, un nuevo plan de emergencia social y económica por 12.000 millones de dólares para hacer frente a los impactos de la pandemia del coronavirus, creando un fondo especial con vigencia de 24 meses, además de ampliar subsidios y extender un plan de protección del empleo, un fondo para reforzar la atención sanitaria y mayor ayuda a los municipios. El plan incluye medidas tributarias como las rebajas de impuestos a pequeñas y medianas empresas entre los años 2020 y 2022, la ampliación del esquema de depreciación instantánea, simplificación regulatoria y medidas para aumentar la liquidez. Además, se aumenta el monto del subsidio de ingresos a la población más vulnerable que había fijado previamente nuestro gobierno, con una serie de planes de protección al empleo, subsidios a familias vulnerables y trabajadores informales por unos 17.000 millones de dólares, para paliar así el efecto de las restricciones impuestas para contener el virus. Señor presidente, sabemos que nada de esto basta por sí solo. En esta crisis que enfrenta la humanidad, debemos relevar el rol del multilateralismo y especialmente del multilateralismo hemisférico, que representa la OEA, como instrumento principal de colaboración, cooperación y coordinación entre los estados de la región. Ahí radica el gran valor de las instancias de participación y debate conjunto entre el Consejo Permanente y el Consejo Interamericano para el Desarrollo Integral. Muchas gracias, señor presidente.
Merci beaucoup, ambassadeur. Avant d'accorder la parole aux délégations restantes, j'aimerais annoncer que l'ambassadeur Philip Spencer de Trinidad et Tobago a annoncé qu'il va soumettre ses propos, son document, sa présentation au secrétariat pour inclure et pour que cela fasse partie de la documentation de cette récolte. Il y a aussi l'ambassadeur de la Bolivie qui a eu une interruption technique, qui va nous envoyer sa présentation. Suivent les présentations. Nous allons accorder la parole au représentant du Canada, après Paraguay, après il y aura la République dominicaine et après un représentant, un observateur permanent. Nous accordons la parole à l'ambassadeur Hugues Gatset du Canada. Monsieur l'ambassadeur, vous avez la parole.
Bonjour, Monsieur le Président. Good morning, colleagues, or good afternoon. It's always nice to see you. I'll try to cut my statement, but I did want to say a few words because this was such an interesting series of presentations this morning and such an important meeting. But let me first welcome, of course, Executive Secretary Kim Osborne, the Assistant Secretary General, and the Secretary General to this morning's discussions as well, and thank both chairs that we have with us this morning for facilitating this joint meeting, which has been so interesting for us. Let me make a couple of points. COVID-19, of course, as many have said, represents a unique and truly global health challenge. It's in a common interest of all of us to work together to address it, and that means bringing together the world's best minds to find vaccines and treatments. But it also means delivering on some commitments, international commitments, to strengthen health systems and to reinforce prevention, emergency planning, and preparedness worldwide. And this was a topic I know that was addressed, for example, by Sir George Elaine this morning so eloquently. We've been trying to do our part by assisting our partners in maintaining services for vulnerable populations, including support for sexual and reproductive health and rights, maternal and child health, food security and nutrition, another topic raised this morning by several speakers, and programs aimed at combating gender-based violence. It was noted as well this morning in the presentations that there's a risk with resources being focused on COVID-19 that other health services could be impacted eroding the gains that have been made in terms of access and overall health indicators. Achieving universal health coverage would provide a critical safety net and ensure healthcare systems are more accessible and resilient. Robust financing structures and increased domestic funding will be critical to achieving this at the national level. And again, that's a point that was raised in some presentations this morning. I know we don't have translation, Mr. Chair, but I wanted to say a few words in French as well, and I'll continue, and the colleagues will get the written text later on. Alors que nous sortons progressivement de cette crise sanitaire, la plupart des pays, dont le Canada, se tournent vers la relance de l'économie. Pour ce faire, il faudra une planification minutieuse des politiques intelligentes et une croissance durable. Nous devons veiller à ce que la reprise soutienne la transition vers une économie plus durable. Nous devons travailler ensemble pour y parvenir, notamment en poursuivant des approches de financement durable par les institutions financières internationales. And we noted the comments of Justin Ram this morning on this topic as well. The acting executive director of the Caribbean Disaster Emergency Management Agency talked about resilience. That's Ms. Elizabeth Riley this morning. And it's an issue that's become more vital than ever as we support the most vulnerable people in countries facing humanitarian crises. For our part, Canada is committed to supporting ongoing efforts to maintain preparedness activities given the oncoming hurricane season. For 2020, Canada's funding includes over $23 million to support vulnerable populations throughout the region, including migrants, host communities, and people affected by natural disasters and violence. And I'd like to make a note at this point of our gratitude for the involvement of Panama, the United Nations, the Red Cross, and other partners in ensuring the efficient use of the Regional Logistics Center for Humanitarian Assistance, which has proven so essential for large-scale emergency response. And finally, Mr. President, if I can, a few words on food security and nutrition, an important topic that was touched on by both Miguel Barreto of the World Food Program and Manuel Otera of the Inter-American Institute for Cooperation on Agriculture. An issue we're closely monitoring, the potential impact of COVID-19 on food security and nutrition for the poorest and most vulnerable countries, especially small island developing states, and that came up in the presentations as well. I know from our end, we're particularly concerned that global food supply chains may be affected by restrictions on farm labor, food distribution, and trade. And this could lead to food price hikes and shortages, which always hit the poor the hardest. We need open, transparent, and predictable trade, critical to keep food supply chains going and prices stable. Export restrictions should be avoided or only employed in a manner consistent with WTO rules, and unnecessary barriers to imports should be avoided to lessen impacts on food security. Most importantly, we have to restore predictability and respect for multilateral rules as soon as possible. Mr. Chair, we could say quite a bit more, but let me close by saying that Canada remains confident that we have it within us in our region to confront this crisis and to emerge from it even stronger than before, provided that we all work together and pull in the same direction. Final note, we were sorry to hear this morning from our friend from Honduras about the illness of the President and First Lady, and would want to pass on our best wishes for a speedy recovery. Thank you so much for your time.
Merci beaucoup, ambassador. Ahora vamos a invitar el representante suplente de Paraguay para hablar. Señor representante, tiene la palabra.
La delegación del Paraguay agradece la convocatoria a esta sesión conjunta para debatir sobre el fomento de la resiliencia tras la pandemia del COVID-19. Consideramos oportunos y necesarios los temas planteados, sobre todo en materia de resiliencia económica, salud, seguridad alimentaria y ante desastres naturales, que todos deben ser abordados integralmente. Como aporte queremos compartir brevemente algunas de las medidas que hemos tomado en mi gobierno. El Paraguay ha tomado medidas extremas en su momento. Afortunadamente, justamente eso nos ha ayudado a frenar los efectos de la pandemia en nuestros sistemas de salud. El lunes pasado hemos entrado en la fase 3 de lo que denominamos cuarentena inteligente, con la reactivación gradual de actividades de más sectores y servicios económicos, con los respectivos protocolos sanitarios exigidos y el estricto control de circulación de personas con horarios de desplazamientos. Asimismo, el gobierno ha tomado algunas medidas de contención económica que incluyeron la ampliación de beneficiarios de los programas sociales ya existentes a la población en situación de vulnerabilidad con el programa titulado Ñangarecó y con las transferencias adicionales realizadas en el denominado programa Tecoporá y la pensión a personas adultas mayores. Actualmente son más de 1.060.000 personas habilitadas en el primer pago y el segundo pago está llegando hasta el momento a 750.000 personas aproximadamente, en el marco de la acreditación del subsidio dirigido a trabajadores informales, cuentapropistas y dependientes de pequeñas y medianas empresas. En otro orden de asuntos, la Secretaría de Emergencia Nacional de mi país ha desarrollado una red de apoyo a asentamientos vulnerables con el fin de coordinar acciones en los territorios más desprotegidos y construir capacidades que permitan a la población mitigar los impactos del COVID-19 en sus barrios, construyendo resiliencia. En el contexto de seguridad alimentaria es importante resaltar que los programas de nutrición a través de las escuelas que se vieron afectadas por la pandemia en mi país continuaron. Se realizó la distribución de kits de alimentos no perecederos a las familias de los estudiantes con el objeto de paliar el impacto económico y nutricional. Por su parte, el Ministerio de Agricultura y Ganadería lanzó el programa de autoabastecimiento a través del apoyo a 150.000 fincas aproximadamente. Este ministerio también ya llegó al objetivo previsto de instalar 50.000 huertas familiares a nivel país, con el objeto principal de beneficiar a familias de asentamientos urbanos y periurbanos en situación de vulnerabilidad para que produzcan alimentos y complementar su dieta diaria. Señor presidente y estimados colegas, estamos convencidos de que la plataforma de convergencia política de nuestra organización y los sistemas multilaterales aquí presentes juegan un papel fundamental y se hace apremiante la creatividad a la hora de buscar y plantear soluciones rápidas e innovadoras. Independientemente de las medidas que han sido aplicadas por nuestros gobiernos, los países deben coordinar acciones para avanzar en la reactivación económica y social que esta pandemia ha causado, para volver a un camino de integración ideal que beneficie a los ciudadanos de las Américas. Muchas gracias, presidente.
Merci beaucoup au délégué du Paraguay. Maintenant, nous accordons la parole à la représentante suppléante de la République dominicaine, la déléguée Lilia Sanchez de Morel. Madame la représentante suppléante, vous avez la parole.
Muy buenas tardes, señor presidente. Señor presidente, señoras embajadoras, señores embajadores, autoridades de la Secretaría General, delegados alternos y países observadores. La delegación de la República Dominicana desea agradecer la convocatoria de esta reunión conjunta del Consejo Permanente y el Consejo Interamericano de Desarrollo Integral, CIDI, con el objetivo de considerar el fenómeno y el fomento de la resiliencia tras la pandemia del COVID-19. Asimismo, queremos agradecer las presentaciones de los distinguidos panelistas. La República Dominicana quiere reconocer la labor de la Organización de los Estados Americanos en promover la resiliencia en temas de vital importancia para la región en momentos de grandes desafíos para sus países miembros. Nuestro país quiere también reconocer el gran impacto que tendrá la pandemia en la eliminación de la pobreza, los sistemas de salud, la alimentación de los más vulnerables y la capacidad para responder a los desastres naturales. Como expresó nuestro canciller en las Naciones Unidas el pasado 17 de abril, La pandemia del COVID-19 nos ha puesto nueva vez ante la insoportable evidencia de que en el pleno siglo XXI, a pesar de que las capacidades productivas son cada vez más eficientes, el cumplimiento del objetivo de desarrollo sostenible de hambre cero no está garantizado. El gobierno de la República Dominicana, antes de presentarse la pandemia, asumió como eje central de su acción la seguridad alimentaria de la población. La Organización de las Naciones Unidas para la Alimentación y la Agricultura así lo confirma. El gobierno dominicano declaró el 2020 como año de la consolidación de la seguridad alimentaria y ha trabajado en consecuencia. Nuestro país produce alrededor de 85% de los alimentos que consume y mantiene en la actualidad la estabilidad de los precios y del suministro de alimentos. Aún así, los efectos de la pandemia serán desastrosos para la región y la República Dominicana no será la excepción. Y aunque se espera que el país termine el año sin recesión económica, los efectos de la pandemia pueden extenderse a lo largo del 2021. De ahí la importancia de las propuestas que hiciera nuestro ministro de Relaciones Exteriores en el marco de la reunión del Consejo Permanente de la OEA el 24 de abril del presente año, cuando se refirió a la creación de un fondo especial en materia de alimentación y salud con el único objetivo de fomentar la habilitación, capacitación y adaptación de los sistemas alimentarios y de salud de los países en vía de desarrollo. Además, debe discutirse la renegociación de las obligaciones de pago de la deuda externa, especialmente de los países que no forman parte de la Organización para la Cooperación y el Desarrollo Económicos, OCDE. Ambas propuestas pueden ayudar a que los países en desarrollo logren solventar el problema del hambre y que los ciudadanos de las Américas tengan acceso a una alimentación adecuada. De igual manera, la República Dominicana ve con simpatía la iniciativa de Guatemala sobre la creación de un proyecto de resolución en el marco de la OEA, el cual abordará el impacto socioeconómico de la pandemia y el compromiso que debemos tener ante la seguridad alimentaria en las Américas. La República Dominicana reitera a los países de la región la propuesta de crear mecanismos que permitan compras conjuntas de insumos para la atención sanitaria del coronavirus y el suministro de alimentos a las poblaciones. El Sistema de Integración Centroamericana SICA experimentó las bondades de un esquema de compra conjunta de medicinas antes y durante la pandemia, con resultados favorables para que los países miembros. Estas iniciativas pueden ser llevadas a una escala mayor que permitan favorecer la eliminación del hambre y una mayor compra de medicinas. En otros aspectos, a partir del sistema de modelos epidemiológicos diseñado por el Ministerio de Economía, Planificación y Desarrollo Dominicano, y en colaboración con los técnicos del Instituto Tecnológico Autónomo de México y el Instituto Mexicano de Seguridad Social, el gobierno de la República Dominicana se encuentra en este momento trabajando en la inclusión de un modelo de mapeo de enfermedades actuales y futuras relacionadas con el COVID-19. Tomando este ejemplo de colaboración y de lo inesperado que fue para las Américas y el mundo esta pandemia, creemos que debemos considerar la creación de un observatorio epidemiológico a nivel hemisférico, que puede emitir una alerta temprana e informar a las autoridades competentes de la gravedad de la pandemia y su expansión. En estos meses nos hemos enfocado en cómo atacar el coronavirus y de cómo no contagiarnos todos al mismo tiempo para que los sistemas de salud de nuestros países no colapsen. Algunos de nuestros estados ya hemos o estamos entrando a lo que se considera la desaceleración de la pandemia y en consecuencia estamos en las etapas de reapertura. Nos espera un gran reto donde todos tendremos que poner en práctica nuestra resiliencia como pueblos, estados, como región y como organización multilateral. La pandemia aún no termina y ahora se conjuga con la llegada de nuestra época de huracanes, donde las amenazas a las cosechas, a las infraestructuras, a la vida humana y animal son devastadoras. Hoy en día, ante los desastres naturales, ya no es suficiente el practicar la prevención y la reconstrucción, sino también la resiliencia, en ser capaces de hacer frente a estos desafíos y empoderar al individuo, a las comunidades y a los países para una recuperación más rápida. Los gobiernos deberíamos de reforzar las políticas públicas y privadas basadas en una sólida planificación para el desarrollo, para así evitar mayores estragos de los que nos dejan los desastres naturales. Se debe afianzar la construcción de las infraestructuras tanto en lo cotidiano como en la fase de reconstrucción después de un siniestro. La República Dominicana, al igual que los países del área, es propensa a sufrir ante los huracanes, inundaciones y también sufre de sequías, y en los últimos años han sido notorios los temblores de tierra en el territorio nacional. La vulnerabilidad que nos arropa nos empuja a abogar por aumentar la preparación en casos de desastres, a fin de dar una respuesta eficaz y mejorar las prácticas. Nuestro país cuenta con el Centro de Cooperación de Operaciones de Emergencia, el cual está encargado de planificar y dirigir todas las acciones de coordinar entre las instituciones del Sistema Nacional de Prevención, Mitigación y Respuestas antes desastre. Asimismo, contamos con la Comisión Nacional de Emergencia, formada por 34 instituciones dominicanas, y también contamos con un Plan Nacional de Gestión de Riesgos. Concluyo diciendo que, dado el incremento tanto en frecuencia como en magnitud de los desastres y sus consecuencias, y ahora pandemias, y la tensión que esos eventos ejercen sobre nuestro sistema de acción, es cuando tenemos que seguir revisándonos y reevaluar qué podemos hacer entre todos como región y como organización para seguir enfrentando cada año estas adversidades. Muchas gracias.
Muchas gracias. Merci beaucoup à la représentante suppléante de la République dominicaine. Maintenant, le dernier, pas le moindre, j'accorde la parole à l'ambassadeur Simone De Santi de la délégation de l'Italie. Monsieur l'ambassadeur, vous avez la parole.
Today. I think I'm the last speaker, so I do make a promise to be very brief. It's kind of the curse of the observer to speak last, but that's how it should be, and that's how it is. Thank you, colleagues. During the last few months, there have been many important discussions on how to increase multilateral cooperation to fight COVID-19, including the recent dialogue with permanent observers, which was held last week, and I thank the OAS and all the members for this initiative. The OAS and member states of the OAS have been in the forefront of these discussions to deal with COVID-19, with new political cooperation, new initiatives, best practices, and experiences shared to fight and recover from this pandemic. I'm not going to mention all of the topics, but I do want to highlight, which I already mentioned during the dialogue, but I do want to highlight one that is very dear to Italy, and especially in its cooperation worldwide and with the Americas as well. And that's the theme of food security. COVID-19 will affect all of our countries in terms of food security in one way or another, whether the most advanced economies or the middle income economies or the more fragile economies. It's an issue that is very important to Italy, also because our capital city, Rome, is a headquarter to what we call the Food Security Hub of the United Nations, which is composed of FAO, the Food and Agricultural Organization, the World Food Program, WFP, which we are happy to have hosted here also today, and IFAD, the International Fund for Agricultural Development. Specifically, in this meeting today, I wanted to mention a new initiative, which is called the COVID-19 Food Coalition, which I've already had the pleasure to share with many of you in different OAS contexts in the last few weeks. And just yesterday, we also circulated a new note with a concept paper on the Food Coalition. The Food Coalition is aimed at mobilizing resources, expertise, providing policy support and promoting innovation to help countries address the disruptions caused by the COVID-19 pandemic in the sector of food security. Because of time constraint, I'm not going to go into the specifics. You will read, of course, the note we sent yesterday, and I appreciate very much the very good positive feedback we have been getting from the member states. I do want to just reiterate that the Food Coalition is meant to be a very open, inclusive initiative, and part of its success will be the countries that join us in this initiative. And let me thank the many countries which have already joined us, of course, in the context of the United Nations in Rome, and I wanted to mention worldwide, and I wanted to mention particularly some countries from the Americas that already signaled their willingness to join the coalition, including Canada, the United States, Belize, Guatemala, Brazil, Argentina, Uruguay, Ecuador. We thank you for this and for staying in the discussion as this initiative proceeds. Of course, we encourage more of you, our friends, to join us, our friends of the Americas, to join us in this very important initiative. And we look forward to see the Food Coalition not only being created, but as a way to encourage more cooperation, more programs, more initiatives, also at the regional level, working with the OAS and the competent bodies of the OAS, of the inter-American system dealing with food security. I thank you very much for this very interesting discussion of today.
Merci beaucoup, ambassadeur, pour cette excellente initiative. Je vous assure, vous n'aurez pas seulement l'appui de quelques pays, mais tous les pays de la région vont vous rejoindre dans cette excellente initiative. Chers collègues, nous avons non seulement épuisé l'ordre du jour, mais dépassé les 4 heures de temps prévus de la réunion d'aujourd'hui. Je voudrais tout d'abord présenter mes remerciements au président de CIDI, l'ambassadeur Intianale, et la secrétaire exécutive de CIDI, Mme Kim Osborne, pour nous avoir aidés à mettre ensemble cette rencontre spéciale pour la région. Comme vous vous rendez compte, tous les points qui ont été traités vont être considérés dans le projet de thème sur lequel les pays, la commission préparatoire est en train de travailler. Avant de lever la séance, je voudrais une fois de plus remercier M. Justin Ram, Sir George Allen, M. Federico Villarreal, qui a représenté l'ICA, M. Miguel Barreto et Mme Elisabeth Riley pour des exposés très instructifs. Nous nous réjouissons à l'idée de poursuivre les délibérations qui ont eu lieu aujourd'hui, tandis que nous soutenons nos gouvernements dans le processus consistant à repenser et à planifier le relèvement en accroissant la résilience et l'efficacité pour un avenir plus durable et plus équitable. Merci beaucoup de votre patience. La séance est levée. Merci.